Hello guys, so now we shall be discussing regarding the thorax. Okay, so we shall discuss all the important topics that are necessary for your exams in case of thorax. So in the thorax, the first important topic which we shall be starting is your thoracic aorta. That is your thoracic aorta. Now when it comes to thoracic aorta, keep one very important thing in your mind. Keep one very important thing in your mind, that how many types, within this aorta, how many parts do we have? Okay, so first of all, let me draw the aorta here and explain you what are the different parts of aorta. So let us say this entirely is your aorta over here. Okay, so roughly I'm telling you that from your left ventricle, this is how the branch arises out, right? So this is your aorta over here. Now in this entire aorta, there are different parts which you have to know. For example, see, till here, till where exactly I will tell you later on, but till here you call this part of aorta as ascending aorta. This is called as ascending aorta. Okay, and this part of aorta is called as arch of aorta. Ascending aorta, arch of aorta. And after that, this part of the aorta you call it as descending aorta. Okay, you call it as descending aorta. Now when it comes to descending aorta, there are two parts. Okay, so half part of the descending aorta is present in the thorax and the remaining half of the descending aorta is present in the abdomen. Okay, so this part of the descending aorta which is in the thorax is called as thoracic aorta, and the remaining part is called as abdominal aorta. Thoracic aorta, and another important part is your abdominal aorta, right? So first we shall be discussing about thoracic aorta today, but before that, as I told you, ascending aorta, right? So where does you, till where you call it as ascending aorta and till where you call it as arch of aorta, so that is very important thing to know. Okay, so first important thing is, let us draw about this ascending aorta. If you look at ascending aorta closely, this ascending aorta is having 1, 2 and 3. There are 3 sinuses. These 3 sinuses are called as aortic sinuses. After this aortic sinuses down here, you have got a small bulb. This bulb is called as aortic bulb. Okay, this bulb is called as aortic bulb. So till here you call this as ascending aorta. So what is your ascending aorta consisting of? Your ascending aorta is consisting of aortic sinuses. So what are all these 3? 1, 2 and 3. What are these 3? These are called as aortic sinuses. Other name for aortic sinus is sinuses of Valsalva. Sinuses of Valsalva. Okay, sinuses of Valsalva or the aortic sinus. Along with that, if you come across this particular aortic bulb, so aortic sinuses and aortic sinuses and this aortic bulb together, you call it as ascending aorta. Okay, so from now onwards, if I ask you what is ascending aorta, what will you tell? Ascending aorta in the sense both aortic sinuses and aortic bulb. Aortic sinuses and aortic bulb together, you call it as ascending aorta. After this ascending aorta, the next part of the aorta which you have over here, okay, you see this part of the aorta which you have over here is called as your arch of aorta. So till where you have to call it as arch of aorta, I will tell you, right? So from where does arch of aorta start? Arch of aorta starts from your aortic bulb. Keep that thing in mind. Arch of aorta starts from your aortic bulb. And remember, if there is any kind of aneurysm, I hope all of you know what is called as aneurysm, right? If there is any kind of aneurysm in the ascending part, this is your ascending aorta, right? So that aneurysm will most commonly occur in the aortic bulb. So aortic bulb is a place where there is most common aneurysm in case of ascending aorta aneurysm. So if there is any kind of aneurysm in the ascending aorta, where it will occur? In the sinuses or in the aortic bulb. Most commonly it is seen in the aortic bulb. Okay, right. Now what we'll do is that let us draw the picture from the side. Okay, let us draw the picture from the side, and there I'll explain you what are the different topographic levels. Okay, so this is very important to know. Let us discuss about the topography. Yeah, so now let us look at the topography over here. Now regarding this topography, from the side if you look, right, so this is your heart from the side view. From the side if you look, okay, from the side if you look, anteriorly what do you have? Anteriorly you have got sternum. So this is your sternum that is located anteriorly, and down here you have got xiphoid process. Okay. Next important thing is, what do you have down over here? Here you have got your diaphragm. Okay. So down over here you have got your diaphragm. Posteriorly what do you have got? Posteriorly you have got your ribs. Now when I am discussing about the ribs on the posterior side, let us say that this particular part over here is T4. This is T4. Okay, so T4, and down here you have got T5, you have got T6, and all the way if I am going down, T7, T8, T9, right, T10, T11, and this is T12. Okay, this is T12. Now here if you look, what are the different kinds of branches over here? So what you have got over here? Ascending aorta. Ascending aorta is having what? Sinuses. See here, here two sinuses and three sinuses are there. So here we have got what? Here we have got bulb. Okay. Now from the bulb region itself, what is starting here? Your arch of aorta is starting. So till here it is ascending aorta. So where is this arch of aorta? Arch of aorta all the way starts from this ascending aorta all the way, and it comes all the way till the lower border of T4. Okay, till the lower border of T4 you have got this arch of aorta. So till the lower border of T4 is your arch of aorta. Now this particular arch of aorta comes down all the way. Okay, this particular arch of aorta comes down all the way. So from the lower border of T4 till the lower border of T4, it is arch of aorta. From the lower border of T4, the aorta which I am drawing is descending aorta. What did I tell you previously? Descending aorta is of two parts, right? One is thoracic aorta and abdominal aorta. So first comes the thoracic. So from the descending part, from the lower part of lower border of T4, this aorta which is coming down all the way till the lower border of T12, right? So this is called as thoracic aorta. Okay, now after the lower border of T12, whatever aorta you have got is your abdominal aorta. Okay, so what are the different aortas we have got here? First we have got ascending aorta. Next we have got arch of aorta. Right, ascending aorta, arch of aorta. Next we have got the thoracic aorta, and we have got the abdominal aorta. Now coming to the ascending aorta, arch of aorta, thoracic aorta, and abdominal aorta, what are the important things? So coming to the ascending aorta, as I already told you, when it comes to ascending aorta is consisting of what? It is consisting of aortic bulb plus three sinuses. Okay. Next, when it comes to arch of aorta starts from the ascending aorta all the way till the lower border of T4. Now from the lower border of T4, okay, all the way till the lower border of T12 is your thoracic. Lower border of T12 is your thoracic. So all the way from the lower border of T12 till the aortoiliac junction is your abdominal aorta. Okay, so these are the parts which you have to know. Now there are some very important clinical points which you need to know. That can you see a specific bulge over here, right? Can you see a specific bulge over here on both the sides? So what is this specific bulge? See here also you can see a small bulge over here. This is very normal, right? This is called, this is nothing but your arch of aorta. right? So when the arch of aorta is arching like this, that will create a bulb over there, okay? Actually it is called as aortic knuckle. But in older individuals, what will happen is that this aortic knuckle becomes more prominent, as shown in the second picture. It is becoming more prominent. You see, you can very clearly see the swelling over here. So if it is becoming more prominent, that is mainly because of atherosclerosis, okay? So this structure over here is nothing but called as aortic knuckle. This is called as aortic knuckle, okay? So aortic knuckle is nothing but your arch of aorta. Aortic knuckle is nothing but your arch of aorta. And remember that this aortic knuckle, for example, it becomes prominent, okay? It becomes prominent in case of what? Calcification, right? In case of atherosclerosis. So when it becomes calcified or atherosclerotic, right? So it becomes more prominent. Second important example, second important clinical point I just want to give over here is that, you know that during the birth, right, before the birth, we have got a duct that is connecting both the aorta as well as your pulmonary trunk. For example, let us say that this is your pulmonary artery, okay? Pulmonary trunk dividing into two branches. This is your right pulmonary artery, this is your left pulmonary artery. And you also know that here you have got what? This is your arch of aorta like this, okay? So this part over here is called as your arch of aorta in this way. This is your arch of aorta like this. Now connecting the arch of aorta as well as the pulmonary artery, you have got a vessel in between. This is called as what? This is called as ductus arteriosus, okay? So what is this particular vessel called as? This is called as ductus arteriosus, okay? Now sometimes it can happen like this, that before this ductus arteriosus there can be constriction. Before this ductus arteriosus there can be constriction of the aorta. So I have to call this as what? Preductal. What is this called as? This is called as preductal, okay? Sometimes what can happen is that, sometimes what can happen is that there can be, this will be normal, right? Before the duct it is absolutely normal. Now in this case it is absolutely normal, but after the duct there can be some kind of, you know, constriction over here. Now this condition you call it as postductal. So one is called as preductal, postductal, and this particular condition you call it as coarctation of aorta. So there are two types of coarctation of aorta. There are two types of coarctation of aorta. Two types of coarctation of aorta. What are the two types of coarctation of aorta? One is called as your preductal, another one is called as your postductal, okay? So there are two types, preductal as well as postductal. So preductal is before the duct, postductal is after the duct, and mostly you will see postductal after the birth. I mean, once this ductus arteriosus is converted into a very thick ligament called as ligamentum arteriosum. Once it has converted into a very thick ligament called ligamentum arteriosum. Now all of you know that the arch of aorta and the pulmonary trunk are separate now, right? So now also after the birth there can be this condition that will be developed. I mean, once the ductus arteriosus is completely, right, obliterated into ligamentum arteriosum, then also it can develop. So there will be also post ligamentum arteriosum, I mean after this ligament. So that is also called as your postductal. So there are two, preductal and postductal coarctation of aorta. What will happen when there is coarctation of aorta? What will happen when there is coarctation of aorta is that, so all of you just look here. If this is your, let us say, arch of aorta, this is your descending aorta like this, okay? All of you know that here we have got an opening, here we have got two openings, let us say, okay? So here the artery which I am drawing here is brachiocephalic trunk, okay? Brachiocephalic trunk divides into right subclavian artery and common carotid artery. Here also you have got left common carotid artery and you have got the left subclavian artery, okay? And all of you know very well that these are the blood vessels that are supplying to your upper limb like this, right? These are the blood vessels supplying to your upper limb. So can I tell like this, that both both the subclavian arteries on both the sides are supplying your upper limbs, right? And down here you have got what? Femoral arteries. Yes or no? Right? Now you have to know one more important thing, that this branch will divide into two. One supplies to one leg, another one supplies to another leg, right? So now look here. For example, if there is coarctation, so let us say here a patient is having coarctation like this, compression, right? There is coarctation, or let us say coarctation is right here. You see, here there is coarctation. Now when there is a coarctation here, now tell me, can the blood easily, see here, can it easily pass down to the descending aorta? No. If it cannot pass, what will happen? The blood stays here itself. And what is going to happen is that there is increased pressure in the right side, increased pressure in the head and neck, increased pressure in the left side also. But look at the pressures in the lower part. The lower part, the pressures are high or low? They'll be low because the blood is not going there. So you have to know the first important point that you are going to see in the patient is that there is a difference in blood pressures in the upper limb and lower limb. There is difference in blood pressures of upper limb and lower limb. Okay, this is the first point. Second important point. What is the second important point? Second important point is that, for example, let me take this artery over here. Okay, so let us also tell that there is some intercostal artery. Okay, so specifically speaking, there will be intercostal artery, but for now, for you to understand, I'm just taking subclavian artery. Okay, now let us say that this is a rib over here. This is one rib, this is another rib. Okay, now let us say that this is your internal thoracic artery like this. Okay, what is your internal thoracic artery? Internal thoracic artery is a branch here of the subclavian artery. Okay, now let us say this internal thoracic artery is giving branches into each intercostal space. Now what did I tell you? I told you that within the subclavian artery there is a high pressure. So obviously see, if this is your subclavian artery, right now within your subclavian artery you have got increased pressure. Because of that, what is happening? Because of that, even in the internal thoracic artery also there is increased pressure. Because of that, within this intercostal artery also there is increased pressure. Now as this intercostal artery is having increased pressure, because of strong pulsations, high pressure strong pulsations, what is happening? This particular intercostal artery is beating the lower surface of your rib. It is tapping the lower surface with constant pressure. So this is the rib, and now look at the artery how it is tapping. You see, continuously it is tapping. When it is tapping the lower surface of the rib, what can happen over here? Don't you think this part of the rib where there is a constant bombardment, there will be a notch that will be formed? Here also down. So there will be a notch that will be formed. So this notch is called as a rib notching, right? If you look at these ribs, you will understand. So here, just have a look over here. So here, can you see a small swelling? Even if it is not clear here, you can see it clearly here. So you can see there is just an elevation of a rib over here, right? So this is called as rib notching. What is this called as? This is called as your rib notching. Okay, so two important things you're gonna see. One is called as rib notching. Another one is called as there is difference in blood pressures in your upper limb as well as your lower limb. Okay, so these are the important things which you're gonna see. Now coming to the third important clinical point which I want to tell you over here is that what will happen, right? So let me draw this part again. Let us say that this is your pulmonary trunk dividing into right pulmonary artery, and this is your left pulmonary artery. Okay, next after that, here you have got an aorta, right? So this is your arch of aorta like this. This is your arch of aorta in this way. Okay, so you have got your arch of aorta like this. Next, after that, what is this? This was a thing which I already told you. What was this? This is called as your patent ductus arteriosus, right? So this thing over here is called as your ductus arteriosus. I'm sorry, this is called as your ductus arteriosus. Now ductus arteriosus, later on it will modify into ligamentum arteriosum. Ligamentum arteriosum, okay, ligamentum arteriosum. Now when does this ductus arteriosus finally close and form this ligamentum arteriosum? Immediately after birth, within 1 week after birth, or automatically it closes within 4 to 12 weeks, okay. So automatically it closes within 4 to 12 weeks. But if it doesn't close even after 4 to 12 weeks, what is going to happen? What is going to happen is that this duct remains open, and this condition you call it as patent. It means open. Patent ductus arteriosus. Patent ductus arteriosus. Okay. So why this condition will develop? One is normally if the baby is premature, if there is a premature birth, right, prematurity, if the baby is not matured enough and the mother has given birth, I mean because of some conditions like hypertension or whatever it is, if the baby is not fully developed, right, he has not achieved a term pregnancy, but before that itself you have delivered the baby, right. So that premature baby, in that premature baby there will be open patent ductus arteriosus, right. Once if it is in the mother's womb, there will be patent ductus arteriosus only, I mean there will be open ductus arteriosus. Yes or no? Once after the birth, slowly what will happen? This ductus arteriosus will close within 4 to 12 weeks. But if you are giving birth to a baby too early, obviously it will be open. And second important thing is that if that mother during her life, I mean during her pregnancy especially, if she is exposed to rubella infection, that also in the first trimester, okay. So mainly in the first trimester. So if there is maternal exposure to rubella in pregnancy, rubella infection in pregnancy, that also in the first trimester, so this can even lead to this patent ductus arteriosus, right. So now what we shall do is that we shall discuss what are the different branches of your thoracic aorta. So we shall discuss the branches of thoracic aorta. So thoracic aorta branches. So what are the branches of thoracic aorta? Coming to the branches of thoracic aorta, what are the important things you need to know? Important things you need to know is that this is your arch of aorta and this is your descending thoracic aorta like this. Okay. And here you have got your brachiocephalic trunk dividing into right subclavian artery and common carotid artery. Here also you have got another common carotid artery. Here also you have got a next subclavian artery like this. So this entire arterial system which I am drawing right now is your descending aorta all the way down here. Okay. Now how many branches are, and by the way here let us say you have got your diaphragm. Let us say you have got your diaphragm over here. Now how many arteries, how many thoracic arteries we have got over here? So there are the thoracic arteries, right, emerging from this thoracic duct, I mean thoracic aorta, they are all the way from 3 to 11. So 3 to 11 pairs of arteries that are emerging out of your thoracic aorta, right. So for example, this is your 3rd, 4th, 5th, 6th, 7, 8, 9, 10, and look here, we have got 11th, and after 11th we have got one branch down here. Okay. So in the same way here we have got your 3rd, we have got your 4th, we have got your 5th, 6th, 7th, 8th, 9th, 10th, 11th, and one branch down over here. So all the way, let me count this first of all. 3, 4, 5, 6, 7th pair, 8th pair, 9th pair, 10th pair, and 11th pair. And this last branch over here is called as subcostal artery. Why? Because it is present beneath the ribs. So it is subcostal artery. Subcostal artery. Okay. So if you look at this particular picture, you will understand why it is called subcostal artery. See why it is called subcostal artery. So far arteries which I have told you, so they come in each intercostal space. Let us say 3rd intercostal space and artery is there, 3rd intercostal artery. Next we have got the 4th intercostal, 5th intercostal, 6th intercostal, like that. And down here after the ribs are done, below all the ribs we have got these arteries, right. Beneath this artery there is no other rib. So this is the last artery over here. This is called subcostal because it is present below all the ribs, right? So this is called as subcostal artery. Right, so we have got around 3 to 11 posterior intercostal arteries. So all these arteries which we have over here arising from the thoracic aorta are called as posterior intercostal arteries. So how many posterior intercostal arteries we have got? All the way from 3 to 11. These are also called as peripheral branches, or these are called as parietal branches, peripheral or your parietal branches. Now coming on to the next group of branches. What are the next group of branches? We have got visceral branches. For example, on the top here we have got an artery, right, and down also here we have got an artery. So the artery on the top and down, these are called as left bronchial arteries. What are these two arteries? These two over here are called as left bronchial arteries. So one artery, one is called as a upper left bronchial artery, another one is called as your lower left bronchial artery, upper and lower. After that we have got two more arteries over here. These are called as mediastinal arteries. Okay, so how many we have got here? Mediastinal arteries. These are your mediastinal arteries. One is we have got the left bronchial, next we have got the mediastinal. After that, down here we have got another arteries over here. These are called as esophageal arteries. What are these called? Esophageal arteries. Mediastinal arteries, we have got esophageal arteries. After esophageal arteries, lastly we have got an artery that is supplying onto the top of your diaphragm. This is called as superior phrenic because top, right? So superior phrenic artery which is supplying your top of your diaphragm. So these are the branches of your thoracic aorta. So now we shall be discussing regarding the development of the heart. Okay, so a topic of discussion would be regarding the development of the heart. So regarding this development of the heart, first important thing you need to know is that heart development starts from a stage called as gastrulation. Okay, so heart development starts from gastrulation, that is around second week. Okay, after that during third week what will happen is that heart tubes are formed. Okay, so first of all we shall directly discuss regarding the heart tubes because this is a place from where most of the MCQs will be asked. So what are these heart tubes, how many are they, right, and what these heart tubes are linear. Okay, how these linear heart tubes are forming their respective derivatives and all we shall discuss. What kind of derivatives are these heart tubes forming, we will discuss. Okay, so first important thing you need to know is that these two channels which I am drawing here, these are called as a outflow. Okay, so when I tell outflow, what do you mean by outflow? Outflow in the sense from the pulmonary artery there is blood outflowing to the lungs, from the aorta there is blood outflowing to the organs, right, the systemic circulation. So outflow I have to draw with the red. So this part over here is your outflow, right. So this is the first part of your heart tube. I'll write down all these things. So this is called as truncus arteriosus, or you can also write it as arterial end. When I tell arterial end, there will also be venous end, right? If arterial end is on the top, venous end will be on the bottom. Yes or no? So this one is called as truncus arteriosus. I'll write these things at the end. But now the second important thing. The second important thing after truncus arteriosus is we have got a bulb-like structure over here. This is called as bulbus cordis. What is this? Bulbus cordis. Okay. After that, we have got a structure over here, right? So this particular structure develops into your ventricle. This particular structure develops into your ventricle, and down to that I am drawing one more structure that develops into your atria. So this particular structure with the pink which I drew over here is called as primitive ventricle, and with the blue which I have drawn over here is primitive atrium, because primitive ventricle is the first formed ventricle. This will later on develop into some structures of the ventricle. The atria also the same. Next, the last part. Now when I am telling you the last part, what should I tell you, right? What should I tell you? That is what did I tell you in the starting? I told you arterial end is on one end, whereas venous end will be on the other end. Arterial end is called what? Truncus arteriosus. Venous end is called sinus venosus. What is it called? Sinus venosus. So this is your sinus venous, and these are the linear heart tubes that are formed over here. Okay, so this is from where you see the blood that is outflowing. Okay, so this is the outflow. Next important thing is this part over here is called as your truncus arteriosus. This part over here is called as your truncus arteriosus. Okay, truncus arteriosus, which end? Arterial end. Truncus arteriosus, arterial end. After that, the next important thing which you have over here is your bulbus cordis. This is your bulbus cordis. Next, third one which you have over here is called as your primitive ventricle. And this one over here is called as your primitive atria. One is your primitive ventricle, another one is called as your primitive atrium. And finally, opposite to the arterial end, we have got the venous end called as sinus venosus. Sinus venosus, which is also called as your venous end. Right now, what we will do is that we shall discuss what these structures in turn are developing into. Right now, when I told you that is truncus arteriosus is the arterial end, what are the main two arteries in the heart? One is pulmonary artery, another one is aorta. Yes or no? See, if you are taking this as an heart over here, see these two are your atrium. We'll discuss the structures later on. And down here you have got your ventricle. Okay, next, the artery which is going from the left ventricle all the way out, this is your aorta. Next, the next important structure that is going from the right ventricle and dividing into two, this is called as pulmonary trunk, dividing into right and left pulmonary artery. So these two are arteries, right? So they are developing from where? Arterial end. So the first point that I have to write over here is that, so truncus arteriosus, I mean, what is it derived into? So let us also write down the heading adult derivatives. In adults, adult derivatives, in adult right derivatives. Right now in me, what is those structures which are the derivatives of truncus arteriosus? So two important structures, as I told you. One is what? Ascending aorta. Another one is your pulmonary trunk. Second one is your pulmonary trunk. Ascending aorta and pulmonary trunk. Now coming to bulbus cordis. What do you need to know about bulbus cordis is that, but before we discuss bulbus cordis, you have to know one very important thing. What is that important thing is that, let us say these are your chambers of your heart. Okay, these are your chambers of your heart. Within the heart chambers, let us say that this is your right atrium, left atrium, right ventricle as well as left ventricle. Okay, now if you look at the ventricle has got two parts. One is called as smooth part of the ventricle, one is called as rough part of the ventricle. For example, if I am dividing the ventricle into two halves like this, okay, so remember this thing, that the upper part of the ventricle, whatever is there, this is the smooth part, upper part of right and left. Here we have got the smooth part. Whereas if you look at the lower part of the ventricle is rough. You see here also the lower part of the ventricle is rough. So ventricle has got two parts. Upper part is the smooth part and the lower part is the rough part. Okay, rough part you also called as trabeculated part. What is that part you called as? Trabeculated. The rough part is also called as trabeculated part. So that's what I was telling you guys. I was telling you that we have got two important parts. Okay, if you look at the ventricle, in the ventricle we have got the upper smooth part and the lower trabeculated part. Trabeculated part is also called as a rough. Okay, for example, if you look at the upper smooth part of, I will show you the real picture. Okay, if you look at the upper smooth part of the right ventricle, okay, so this part is called as conus arteriosus. Okay, so what do you call the upper smooth part of the right ventricle? As conus arteriosus. In the same way, if you look at the upper smooth part of the left ventricle, you call it as aortic vestibule. You call it as aortic vestibule. Aortic vestibule. Remember one thing, the outflow tracts whatever are there, like pulmonary artery, aorta, these are the outflow tracts, right? The outflow pathways are smooth, the inflow pathways are not smooth. Okay, so whatever it is, don't get confused over here. So just remember that in each ventricle there is a smooth part, there is a rough part. Smooth part in the right ventricle is called conus arteriosus, and the smooth part in the left ventricle is called as aortic vestibule. Okay, the same things we even have within the right atrium as well as left atrium as well. Okay, so in the right atrium and left atrium also you have got trabeculated part, you have got smooth part. Okay, so if you come back to this particular slide over here, let us say bulbous cordis. Let us say bulbous cordis. What is bulbous cordis developing into? First important thing, bulbous cordis will develop later on into the smooth upper part of right ventricle. What is the smooth upper part of right ventricle called? Conus arteriosus. So it will develop into conus arteriosus, and the second important part is smooth upper part of the left ventricle. What is smooth upper part of the left ventricle called? Aortic vestibule. Aortic vestibule. So it develops into two, that is a conus arteriosus and aortic vestibule. Now after that, coming to the ventricle. Now when it comes to the ventricle, already regarding the ventricle we have discussed two things. What we have discussed? The two things already regarding the ventricle we have discussed two things. What are those two things? One, we discussed about conus arteriosus, another one we discussed about aortic vestibule. These two are the smooth parts of the ventricles. These are the smooth parts of the ventricles. We did not discuss about the rough part. But when it is coming to primitive ventricle, then what are the other parts in the ventricle that are left over here? That is the rough part. Okay, rough part is also called trabeculated part. So what I have to write? I have to write here as primitive ventricle will develop into trabeculated part of, first one is your right ventricle, and next is trabeculated part of your left ventricle. Two, trabeculated part of your right ventricle and trabeculated part of your left ventricle. Coming to primitive atrium. Okay, primitive atrium, again primitive atrium will develop into trabeculated part of right atrium, and next what do we have? Trabeculated part of left atrium. So all the primitive structures will develop into its trabeculated parts, that is the rough part. Okay, now what is developing into this one? Sinus venosus. See, very easy. First I told you about smooth part. These two are smooth parts. One smooth part is done regarding the ventricles, then we discuss the rough part regarding the ventricles. So smooth and rough of the ventricles are done. Next, I also told you that there is a in the atrium also you have got smooth and the rough parts. Already we discussed the rough parts over. So what is left? Smooth parts. So smooth part of right atrium is called as sinus venerum. Okay, so sinus venosus develops into sinus venerum. Second one is it develops into coronary sinus. And last important thing is it will also develop into, and by the way this is venous end, so it should develop into one vein. What is that vein? Vein of left atrium, oblique vein of LA, that is your left atrium. Okay, but here let me write these things down over here, So yeah, what are these things down? If there is a smooth part of right ventricle, smooth part of left ventricle, smooth part of right ventricle and left ventricle. What is your smooth part of right ventricle called as? It is called as conus arteriosus. What is the smooth part of the left ventricle called as aortic vestibule? Aortic vestibule. Okay, remember these two things, and remember this also. Then what do you call as sinus venerum? Sinus venerum is nothing but the smooth part of right atrium. So this is the smooth part. Okay, smooth part of right atrium is called as sinus venerum. So now if you look over here, can you see all these trabeculae over here? Right, now tell me, all these trabeculae are smooth or rough? They are rough. So that is why lower part is rough, upper part is smooth. Upper part is smooth in the sense, see here, isn't it smooth? Look over here also, isn't it smooth? Let me show you to you in another picture. Okay, so look here now, look here, see this lower part is all rough, but look at the upper part, isn't it smooth? The upper part is called what? Upper part is called as vestibule, I told you, right? You see, upper part is very smooth. Okay, let me, if I have another, no, I don't have any other picture. So these are the pictures. Let me see if I manage to get another picture over here. I think only these two. Okay, yeah, I think only these are the pictures which I have. So we have got the vestibule. So I'm just showing you as an example. I'm not showing you all the parts over here. I'm just showing you what is called as a rough part, what is called as smooth part. Okay, and yeah, so these are some of the important things in the development of heart. So now we shall be discussing regarding the respiratory system development. Okay, so how does the development of respiratory system happen? Development of respiratory system. Development of respiratory system. Now in this particular development of respiratory system, you need to understand that a respiratory system develops in 4 stages. What are these 4 stages? I will discuss, but before discussing those 4 stages, it is very important to know what are the parts of the respiratory system. So all of you know a very basic thing. Let us say this part which I am drawing right now over here is called as primary bronchi. Okay, so what is this particular part which I am drawing right now? Primary bronchus. So, or you can call it as principal bronchus. Primary bronchus. Okay, other name is principal bronchus. Primary bronchus or principal bronchus. Okay, what will happen in the next stage? This primary bronchus will in turn divide into 2 more bronchi. What are these 2 more bronchi called as? These are called as secondary bronchus or lobar bronchus. These are called as secondary bronchus, or you can call it as lobar bronchus. Secondary bronchus or lobar bronchus. Now this secondary bronchus, see, first primary, after that secondary, after secondary what will be there? Tertiary. So secondary bronchus also in turn develops into 2 more bronchi. These are called as tertiary bronchus. Okay, or you can also call them as segmental bronchus. Tertiary bronchus or segmental bronchus. So first we have got primary bronchus, next we have got secondary bronchus, third we have got tertiary bronchus, and next we have got another bronchus, the last one, that is called as terminal bronchus. Okay, so the last one over here is this part. This is called as your terminal bronchus. So this one, let me elongate it a little bit. Yeah, so this part over here is called as your terminal bronchus. Terminal bronchus. Okay, now from here till here, what do you call it as? I'll tell you later on. Now from here, let me change the color over here. Okay, so let me change the color. Now after terminal bronchus also will divide into 2 important structures, 2 important bronchi. These are called as lobar bronchioles. So far bronchus is finished. From now bronchioles will start. Okay, so first we have to discuss about, this is called as lobar bronchiole. Not bronchus again, it is lobar bronchiole. After lobar bronchiole, next bronchiole which you have over here is your terminal bronchiole. Okay, after lobar bronchiole, the next bronchiole which you have over here is called as your terminal bronchiole. So this is called as your terminal bronchiole. And finally we have got one last bronchiole over here. That particular bronchiole over here is called as a respiratory bronchiole. So finally we have got this bronchiole called as respiratory bronchiole. Now what is to do with this respiratory bronchiole? From this respiratory bronchiole a duct will arise. Okay, from this respiratory bronchiole a duct will arise like this. Okay, what do you call this duct? As alveolar duct. Alveolar duct will divide into branches in this way. This is the thing. Okay, so what is this particular duct over here? This is called as alveolar duct. Okay, alveolar duct. After alveolar duct, you see this area where it is dividing into three separate regions. So this particular area is called as atrium. This particular area is called as atrium. And next it is dividing into multiple sacs. Okay, so each one of this, see, each one of this is called as a sac. What sac is this? Alveolar sac. See, let us say this part, and let me select this one. See, this part over here is called as your alveolar sac. So a group of alveolar sac together, all these groups of alveolar sacs together, you call it as alveoli. You call it as alveoli. Okay, group of alveolar sacs together, you call it as alveoli. Now all this part which I have drawn with the blue, what do you mean by which I have drawn with the blue? It means all the way till this particular terminal bronchus. Okay, all these structures over here which I have drawn, like primary bronchus, secondary bronchus, tertiary bronchus and terminal bronchus, all these are called as the conducting part of the respiratory system. All of these are called as a conducting part. They only conduct the things. They only conduct the air. There is no exchange of gases happening here. But coming to the next green color part over here, this is called as the respiratory part. So if I ask you, the main exchange of gases takes place in the conducting part or respiratory part, that takes place in the respiratory part. Here is the place where oxygen and carbon dioxide are delivered. Now let us see which structure from these are developed. This is very important. Okay, so what did I tell you? I told you that your entire respiratory system is developed from 4 different stages. Now how do you remember these 4 different stages? Remember that, like, let us say, please can someone get tea. Okay, remember it as please can someone get TEA, T. Okay, so no, it is TEA, T. Okay, please can someone get a T. So what do you mean by P over here? P stands for pseudoglandular stage. What did I tell? I told you 4 stages. One is pseudoglandular stage. So let me write down the heading. What are the stages? Okay, pseudoglandular stage. After pseudoglandular stage, the next CAN stands for canalicular stage. Canalicular stage. CAN stands for canalicular stage. Next after that we have got TE stands for terminal sac stage. TE stands for terminal sac stage. Okay, and finally A stands for what? Alveolar stage. Alveolar stage. So there are how many stages? 4 stages: pseudoglandular stage, canalicular stage, terminal sac stage and alveolar stage. You just have to remember one thing here, that is what is a period of time. Okay, so pseudoglandular stage is at around 5 to 17 weeks. Okay, during this time there are some structures that are developing. I'll tell you what is that. And after that, during 13 to 25 weeks. Okay, and next, coming to the terminal sac stage, 24 weeks all the way till the birth. Okay, even after the birth also there are the development of lung takes place. Okay, for example, after the birth, 8 months to 8 years. 8 months to 8 years. So these are the only numericals which you have to remember. Remaining all are easy. Let us see what are the developments that are happening. What are the developments that are taking place over here, right? So first, in pseudoglandular stage, what does what develops over here? Pseudoglandular stage leads to the development of entire conducting part. It means all the way from the primary bronchus till the terminal bronchus. When is this primary bronchus till terminal bronchus developed? During 5 to 17 weeks of gestation, right? It means which stage is that? That is your pseudoglandular stage. Okay, so your entire conducting, okay, your entire conducting airway system up to where? Terminal bronchiole or bronchi. Yeah, it is your terminal bronchus. Okay, so coming to the pseudoglandular stage. So in pseudoglandular stage, what are developed? All the conducting system up to the terminal bronchiole. So entire conducting system, and in the respiratory part you see lobar bronchial and terminal bronchial till here. Okay, the entire conducting part along with till the terminal bronchial till here, all the structures which are developed, they are developed in a pseudoglandular stage. Okay, so it means what you have to write over here? So all the conducting, right, all the conducting airway system, up to what? Up to terminal bronchiole. Okay, up to terminal bronchiole, till here, right? You call it as a pseudoglandular stage. Now coming to what is canalicular stage? Canalicular stage in the sense development of your respiratory bronchiole, alveolar ducts, right, alveolar sacs and alveoli. Okay, the rest of the part. So what is the rest of the part? That is your alveolar ducts, you have got your alveolar sacs, right? Alveolar ducts you have got alveolar sacs, and by the way, not to forget, what is this? Respiratory bronchiole. Yeah, your respiratory bronchiole as well. Okay, your respiratory bronchiole, and still what are the other things that are terminal sacs? Sir, what is terminal sacs? Terminal sacs are nothing but your alveolar sacs. You see, these alveolar sacs they are completely present on the terminal end, right? So you call them as terminal sacs. Okay, so I hope you are understanding, right? So till the terminal bronchiole, whatever structures they are developed in the pseudoglandular stage. After that, the remaining part, whatever is there, they are all developed in the canalicular stage. Now tell me, if a baby is born in the 5 to 17 weeks, right? You tell me now, if the baby is born in this particular age gap between 5 to 17 weeks, do you think will the baby survive? No, there are no chances that the baby can survive. Why? Because the baby cannot inspire, or there is no respiration taking place. Why? Because only the airways are formed till the terminal bronchioles, but the gas exchange, real gas exchange, happens from alveolar sacs, terminal sacs and all. Okay, so these structures have to be formed for the respiration to occur. So if the baby is formed between 17 to 25, after 17 till 25, in between, if the baby is born, still you call it as a premature baby. Okay, but still you can manage well, so that some of the babies can survive. The survival rate is not good, but I can tell you that rarely the babies can survive here. But here, if the baby is born at this particular group, they will not at all survive, because lungs itself are completely not formed. There is no exchange unit there. But here there are exchange units, but very weak exchange units, right? So that's what I'm telling you. If the baby is born between 17 to 25, there are chances that the baby could survive. Okay, the premature baby could survive. So remember this important thing. Okay, so I'm just writing it down over here, that if there is a premature infant do not survive over here. So here, if the premature infant is there, okay, there are less survival rates. It means the baby would survive, but rarely. Okay, right, rarely, right? Now coming to this one, coming to 24 weeks till birth. So what are the structures that are developed during 24 weeks till birth? Is that, see, alveolar sacs are already formed in the canalicular stage, right? In the terminal sac stage, much more alveolar sacs are formed, or terminal sacs, both of them are same. So there is increase in number of terminal sacs, Increase in number of terminal sacs. So if the terminal sacs are increased, it means more exchange will happen. Not only that, within your alveoli, you have got two types of cells, right? You know, type 1 alveocytes, type 2 alveocytes. Type 1 and type 2. Type 2 alveocytes are surfactant producing alveocytes, right? So along with this, what are formed? Type 1 and type 2 alveocytes. Type 1 and type 2 alveocytes are also developed over here. Okay, so this is one of the very important thing you have to know. And next important thing, what happens if the premature is born? Yes, if the premature infant is born, you see now there are increased number of terminal sacs. Very well, all the systems are developed right now, even alveocytes are also developed. So now tell me, if a premature infant is born, will he survive or no? Yes, there are increased survival rates only under intensive care unit. Okay, so the survival rates are increased. So there are increased survival rates. Okay, next important thing, 8 months to 8 years, what structures are developed here? There are no much true structures that are developed. You know all these things already. All the structures are developed previously, only they just increase in number. For example, terminal sac, that is already developed during 13 to 25 weeks. But what is happening in the terminal sac stage? There is only increase in number of terminal sacs. In the same way, you see the alveoli are already developed during 13 to 25 weeks, right? But what is happening here is that there is increased number of alveoli that are developed. Okay, what is happening? There is increase in number of alveoli. Not only that, there is increase in number of type 2 pneumocytes. Again, what are these pneumocytes? Pneumocytes are also called as your alveocytes. So type 2 alveocytes or pneumocytes number is increased over here. Okay, so these are the structures that are developed from what? From these derivatives over here at these particular stages. So this is how the lung development usually takes place. So guys, now we shall be discussing about ribs. Okay, how do you classify ribs? There are different kinds of classification of ribs. Okay, based upon first classification, what we'll discuss is types of ribs. So based upon types of ribs are basically classified into two different types. Okay, how many types? Two different types. What are these two different types? One are called as typical ribs, another one are called as atypical ribs. So we have got, one is called as typical ribs, another one is called as atypical ribs. So what are these typical and atypical ribs? Typical ribs are all the way from rib number 3 to rib number 9 is called typical ribs. What are atypical ribs other than this? Before 3, what do we have? 1 and 2. After that, what do we have? 10. And after that, we have got 11 and 12. So these are all the atypical ribs. Okay, so we have got typical, we have got atypical. These are based upon the types of ribs. Now the classification based upon the relation, ribs in relation with the sternum. Okay, so classification based upon ribs in relation with the sternum. So ribs in relation with the sternum. In relation with the sternum, we have got again two different classifications. What are those two different classifications? All of you know, just think casually that, you know, this is the sternum in the center. Backside, what do we have? We have got the vertebral bodies. Okay. For example, if a rib is attached, all the ribs start attaching, all the originating from the vertebral bodies. So if the ribs are starting all the way back from the vertebral bodies and they are starting there and coming in the front and attach it to your sternum. See, in the front there is sternum, in the back there is vertebral bodies. From the vertebral bodies, if a rib is coming all the way and attaching to the sternum, such ribs are called true ribs. Okay, if a rib that is starting in the vertebral column on the back, but it is coming in the front and not attaching to the sternum, such ribs are called as false ribs. How many true ribs are there? 7. How many false ribs are there? 5. So the upper 7 ribs are all true ribs, the lower 5 ribs are all false ribs. So I will write down these things anyways. So we have got two important based upon in relation with the sternum, that is true ribs another one is your false ribs. Okay, we have got true ribs, we have got false ribs. Now what do you mean by true ribs? True ribs in the sense ribs all the way from 1 to 7 are called as true ribs. False ribs in the sense 8 to 12. Okay, or you can simply remember as upper 7, lower 5. Lower 5 ribs here. Okay, now why do you call these as true ribs? Because they articulate, they see all the ribs, they have to arise from the vertebral body only. Okay, but after arising from vertebral body, where are they going and inserting is what matters. For example, in true ribs, right, all these ribs, they articulate with the sternum anteriorly, yes or no? All these true ribs, they articulate with sternum like this in the front, with sternum anteriorly, with sternum anteriorly. These are called as true ribs. Now what do you mean by false ribs over here? False ribs in the sense they do not articulate with the sternum. They do not articulate with sternum. So ribs that do not articulate with the sternum, they are of two groups. Okay, they are of two groups. What are these two groups? What are these two groups are? Some ribs from the back, they come in the front and attach to the joints. Okay, they attach to the repeat. They come in the front and attach it to the joints. Okay, they are called as costal cartilages. So they attach it to the costal cartilage. If a rib from the back, it is coming to the front and attaching to the sternum, they are called true ribs. If a rib from the back is coming and attaching to the costal cartilage, I will show all this in the form of pictures. Okay, costal cartilage, these are called false ribs. If a rib from the back, it is coming and not attaching to anything, right, not to the sternum, not to the costal cartilage, they are also called as false ribs. Okay, but these ribs are called floating ribs. Okay, let me instead of writing this, they do not attach to anything, they do not attach anything, they do not attach anything. Okay, so what are the ribs that are starting from the vertebral bodies, coming in front and attaching to the costal cartilages? Those ribs are the lower 5 ribs. It means rib number 8, 9, 10. These 3 ribs, they come from the back to the front and attach to what? Costal cartilages, and which do not attach to anything, that is your 11 and 12. If you look at the pictures, you will understand over here. Now look at these pictures over here. Now in these pictures, what are the important things you can see? See here. First here, you can see a rib that is attached to the sternum here. True rib. 1 is true rib, right? So let me write it down that this is 1, right? This is 2, this is 3. Okay, let me use smaller ring for better. 1, this is 2, this is 3, this is 4, this is 5. Right, this is 6, and there should also be 7th, so this is your 7th one. Okay, so all these 7, you see, 1 is directly attached to sternum, 2 is also attached to sternum, 3 is also attached to sternum, 4 is also attached to sternum, 5 is also attached to sternum, 6 and 7 is also attached to sternum. But look, pay attention at 8, 9 and 10. You see, are these 3 directly attached to sternum, or they are attached to this part? You see, they are attached to this horizontal part. This part is called costal cartilage. So 8, 9, 10 are attached to your costal cartilage, and costal cartilage is in turn attached to your sternum. Okay, that's what I was telling you here. So from the back, all these are false ribs only. They start from the back and they are attached to the costal cartilage 8, 9, 10, which do not attach to anything, in the sense, you see this rib over here, is it attaching to anything? No. You see the rib down here, it is starting from the back, is it attaching to anything? No. So these two ribs which are not attaching to anything are called as floating ribs. Okay, what do you call them as? Floating ribs. So these ribs over here are called as floating ribs. These ribs over here are called as what? These ribs over here are called as floating ribs. If you look at this picture, you will understand much more better over here, right? So here 1, 2, 3, 4, 5, 6 and 7. Till here you got it as a true ribs. You see, they are all true ribs. They all the way start from the vertebral column on the back, right? Come front and attach to the sternum. That is why you call it as vertebrosternal joints. Okay. Next, look at 8th, 9th and 10th. These 8th, 9th and 10th are attached to the costal cartilage here. You see, this is a costal cartilage. So these ribs of 8, 9 and 10, these are starting from the vertebral column all the way in the front, attached to your what? This particular part called as cartilage. So vertebro on the back, cartilage in the front, vertebrochondral. What is this? Vertebrochondral. So one you have got is a vertebrosternal, another one you have got is a vertebrochondral. Clear? So these are the important things which you need to understand regarding the classification of the ribs. So guys, we shall discuss what are the different kinds of nerves in a single table that are present in the thorax. So this will cover up all the nerves that are present in the thorax. Okay. So an easy mnemonic that you have to remember is that, so if you are working hard persistently, right, so obviously you will reach to the peak stages in your career. So how do you write that down as a mnemonic? So it is very persistent. Okay. So very persistent individuals securely, safely, securely they reach in their career to the peaks. Okay, I don't think so it is difficult to remember. Now V here, what does V here stands for? Just you can guess. V here stands for vagus nerve. Okay, now we shall write down from where is this vagus nerve coming. Vagus nerve, where does it come? It comes all the way from the medulla of what? Brainstem. Medulla of brainstem. Okay, so what does this vagus nerve do? Vagus nerve will form few important plexus. Okay, so what are these plexus? One is called as pulmonary plexus. Another one is called as esophageal plexus. It will give off pulmonary plexus, esophageal plexus, and next it will give off cardiac plexus. So pulmonary plexus, esophageal plexus and cardiac plexus. We shall study in detail about each and everything right now here itself. Next, after that, persistent. P here stands for phrenic nerve. Okay, P here stands for what? It stands for phrenic nerve. So from where does this phrenic nerve come? This phrenic nerve starts from the anterior rami of C3 to C5 spinal nerves. You know, spinal cord has got spinal nerve. Okay, let me show it to you. Let me draw it up over here. Let us say if this is your spinal cord. Okay, this is your spinal cord. Just a rough picture. Okay, this is your spinal cord, for example. Now you know that here we have got this is a dorsal root, this is a ventral root, dorsal and ventral root of the spinal cord. Together they form what? Spinal nerve. So this structure which I am drawing with the pink over here, you see this structure is called spinal nerve, and spinal nerve divides into two. One branch goes to the back and the other branch comes onto the front. So one branch going to the back is called as dorsal rami, and this one over here is called as your ventral rami. Let us say this segment of spinal cord is C6 segment. So this is the ventral rami of C6. In the same way, ventral rami of C3, C4, C5, right? So from all this ventral rami of C3, C4 and C5, whatever is formed is your phrenic nerve. So what does phrenic nerve do? Phrenic in the sense of what? Your diaphragm. So it supplies to your central portion of diaphragm. Central portion of your diaphragm. Central portion of your diaphragm. Next, after P, next letter we have got is I. I and N. IN stands for intercostal nerves. What does IN stands for? Intercostal nerve. We will discuss about intercostal nerves in detail. Okay, so actually there are 11 pairs of intercostal nerves. So all the way 1 to 11, 1 till 11. First pair, second pair, third pair, fourth pair, like that 11 pairs. Okay, each pair arises from its own segment. For example, so these intercostal nerves, they start originating from T1 till T11 nerves. T1 till T11 nerves, spinal nerves. Okay, from T1 spinal nerve, intercostal nerve 1 will arise. T2 spinal nerve, second intercostal nerve will arise. From T3 spinal nerve, third intercostal nerve will arise. Like that, 11 intercostal nerves arising from the 11 spinal nerves over here. Okay, now what does this intercostal nerves do? What do they do is that they supply, see, what is intercostal? If this is a rib, below that there is another rib, the space in between both the ribs is called intercostal space. Within this intercostal space, what do you have? Muscles, intercostal muscles. So they will supply intercostal muscles, and not only that, even skin, muscles and skin of what? Intercostal space, ICS, intercostal space. Next, after T11, the last one is called 12th. This 12th is present below all the ribs. See, again I am telling you here. So let us say till here there are 10. Okay, and if I am drawing one last, see, if I am drawing a nerve between two ribs, one on the top, one on the bottom, this is called as intercostal space. Intercostal space, within this intercostal space, this nerve is called intercostal nerve. See, this one is also called intercostal nerve. This one is also called intercostal nerve. This one is also called intercostal nerve. This is also called intercostal nerve. But if I am drawing a nerve here, on the top there is a rib, but down, do you have any ribs? No. So this nerve which I have drawn over here is present below all the ribs. All the ribs is called subcostal nerve. So the next important one after I, S here stands for subcostal nerve. Okay, what does S stands for? Subcostal nerve. Subcostal nerve. So subcostal nerve is what? Below T11. So in the first intercostal space, first one. Second intercostal space, T2, second one. So in the same way, 11 intercostal spaces, 11 nerves are done. Now, after the 11th, the last one is called T12. It arises from T12. It arises from T12 nerve, right? And that is called as a subcostal nerve. And what does this subcostal nerve is do is that this supplies to the abdominal wall and skin of gluteal region. Abdominal wall and skin of gluteal region, abdominal wall and skin of gluteal region. After subcostal, you have got what? A recurrent laryngeal nerve. Recurrent laryngeal. All of you know, recurrent laryngeal nerve is a branch of what? Vagus nerve. It's a branch of vagus nerve. What does this recurrent laryngeal nerve do? It supplies to all the intrinsic muscles of larynx except cricothyroid. It supplies to all intrinsic muscles of larynx except what? Cricothyroid muscle. Except your cricothyroid muscle. Okay. Next, coming to the last important thing, I've told you 3 important plexus, right? What? Pulmonary plexus, esophageal plexus and cardiac plexus, right? So first let us start our discussion with the cardiac plexus. Cardiac plexus. Now tell me, cardiac plexus originates from the vagus. Now all of you know cardiac plexus originates from the vagus. Now we have already discussed in the starting. Now what does this cardiac plexus do basically? Okay, so these cardiac plexus is having both sympathetic fibers, it is having both parasympathetic fibers. What does sympathetic fibers do? They increase the heart rate or decrease the heart rate? They increase the heart rate. What does parasympathetic fibers do? They do the opposite action, that is they decrease the heart rate. Next, sympathetic fibers increase the force of contraction or increase the force of contraction. Opposite to that, they will decrease the force of contraction over here. Next important thing is that this cardiac plexus is very important. Why? Because it supplies to your SA node. It gives innervation to your SA node. Very important. After cardiac, we shall discuss about the pulmonary plexus. After that, we shall discuss about pulmonary plexus. Again the same. It originates from the vagus nerve. Here also, what do we have? We have got both the sympathetic nerves, plexus in the sense we will have both sympathetic and parasympathetic. Okay, sympathetic and parasympathetic. What does it do with the sympathetic? Sympathetic will dilate the bronchioles. It will dilate the bronchioles. So obviously, parasympathetic will constrict the bronchioles. Constrict the bronchioles. So one will dilate the bronchioles and the other one will constrict the bronchioles. Finally, we have got our esophageal plexus. esophageal plexus. Again, from where is it coming? It is coming from the vagus nerve, and also remember it is also coming from greater splanchnic nerve. Vagus plus greater splanchnic nerve. Okay, so what does it do? What does it do is that it gives innervation to the smooth muscles. You know, esophagus is made up of smooth muscles, and within this esophagus you have got glands also. So it gives innervation to the smooth muscles and glands of esophagus in the lower part, I mean the inferior two-third. So it gives innervation to smooth muscles and glands of inferior two-third of your esophagus, So this is all the important things which you need to know regarding what? Regarding the nerves of the thoracic cavity. So these are all the nerves of thoracic cavity, nerves of the thorax. Okay. So now we shall be discussing regarding the intercostal muscles. Okay. Intercostal muscles or the muscles of your thoracic wall. Okay. Thoracic wall muscles. Thoracic wall muscles. So we shall discuss the important things over here. Now, before I draw the picture and tell you, one very important thing you need to know is that what do you mean by intercostal space? Intercostal space in the sense, you know this better, that this is one rib and there is another rib down. Okay, so this space which whatever you can see over here, right, this space whatever you can see over here is called as a intercostal space. So within this space, right, so this is called as intercostal space. The muscles which are located over here are called intercostal muscles. The nerves which are located over here are called intercostal nerves. The arteries and veins are intercostal vessels. So first we shall discuss about intercostal muscles. So when you discuss about intercostal muscles, there are basically three different types of intercostal muscles. Okay, what are these three different types of intercostal muscles? The outermost layer is called as external intercostal muscles. Outermost is called external intercostal muscles. Second one is called internal intercostal muscles. External intercostal ek ho gaya. Next one is your internal intercostal, and third one is called as innermost intercostal muscles. So first you have got is the external intercostal. Next in the middle, internal intercostal. Innermost is called as innermost intercostal. Okay, now this one over here is also called as your superficial group of muscles. Next, the internal intercostal is the middle group of muscles, right? They're present in the middle or intermediate. And next, down here, these are called as a deep group of muscles. Okay, these are your deep group of muscles. Now, if you talk only about these innermost intercostal muscles, these innermost intercostal muscles are again divided into three different types. What are those three different types? Remember by the mnemonic SIS. So, S here stands for subcostalis. S here stands for subcostalis. I stands for intercostalis intimus, and S stands for sternocostalis. So three important muscles over here. What are those three? Subcostalis, intercostalis intimus, and sternocostalis. All these are the parts of what? Innermost intercostal muscles. Okay. So first we shall look how does these external intercostal muscles are present. Then we will discuss about the innermost intercostal muscles. Okay. So let us say that this is your sternum body and the xiphoid process. So here let us say you have got a rib, okay, and down over here you have got another rib. So the space over here is called as your intercostal space. Now in this particular intercostal space, let us now draw both the external and internal intercostal muscles. For example, let us start with the external intercostal muscles. Okay, external intercostal muscles, they are projected in this way. You see, this is a projection of external intercostal muscles. Now tell me how these muscles are coming, how these muscles are drawn. These muscles are drawn downward. Yes or no? These muscles are drawn downward. So let me write down here it as external intercostal muscle. These muscles are drawn downward, and they are drawn downward towards the midline. You see, these muscles are touching the midline like this. They are drawn towards the midline. So downward they are drawn and medially, downward and medially. In the same way, you have got the next group of muscles in this way. Now tell me, these are drawn downward or upward? They are drawn upward. Okay, by the way, what are these? These are your internal intercostal muscles. So internal intercostal muscles are drawn upward. Yes or no? They are drawn upward and towards the midline. So again, medially, upward, medially. So one is downward medially, another one is upward medially. Okay, so these are the three important things which you have to know over here. Apart from this, we will discuss about innermost intercostal right now, right? So here, once I will draw all the muscles over here, then I will explain you whenever you are wanted to do a pleural tap. Whenever there is excess fluid within the pleural cavity, you do a tapping called as pleural tapping. It means you put the needle all the way into your, you put the chest tube all the way into your pleural cavity and drain the fluid out there. Okay, so how do you do that? I'll explain you. But first important thing you have to know, from outside to inside, what layers are there. From outside in the sense skin all the way inside till the pleural cavity, what layers have you have to pierce in order to enter into the pleural cavity, we will discuss. So you know, posteriorly what do we have? Posteriorly here we have got, what is this? This is called as your vertebra, right? So posteriorly you have got your vertebra like this. Yeah, so posteriorly you have got your vertebra, and anteriorly, what do you have anteriorly? Anteriorly you have got your sternum. Posteriorly you have got your vertebra, and anteriorly you have got your sternum. And you know that you have got lungs in between. You have got lungs in between. So anteriorly sternum, posteriorly vertebra, and you have got lungs in between. Now tell me, what is the outermost layer here? What will be the outermost layer which I am drawing over here on both the sides? I am drawing only on one side. Outermost layer is the skin. After this, what is the next important muscle you have got? I told you that is your external intercostal muscle. See here, this particular muscle which I am drawing over here is your external intercostal muscle. So this muscle over here is your external intercostal muscle. Now after this external intercostal muscle, right, after this external intercostal muscle, the next layer of muscle which you have got is internal intercostal muscle. So let us draw this internal intercostal muscle all the way here. So once after external intercostal is done, so this particular muscle over here is called as your internal intercostal muscle. Okay, so external intercostal and internal intercostal are done. After this, what did I tell you? You have got innermost intercostal. There are three innermost intercostal. What are they? SIS. Subcostalis, intercostalis intimus, and sterno. What is this? Sternocostalis. So first SIS. So S here, where is S over here? Let me draw it with the blue. Okay. Okay, let me use the pink over here, or another type of red. Yeah. So first important muscle over here which I am drawing here, this is called as your subcostalis muscle. After subcostalis, the next muscle which I am using here is intercostalis intimus. Then a muscle that is attached to the sternum is called sternocostalis. Okay, so this muscle here over here is called as your subcostalis. Next muscle over here is called as your intercostalis intimus, and the third muscle over here is called as your sternocostalis. So there are three muscles over here. And by the way guys, remember one thing, these muscles are attached with the help of a sheath like this. Okay, a tendinous sheath. Don't worry about that. They are attached to each other with the help of a tendinous sheath in this way. Now once we are done with all these muscles, once we are removing all these muscles, the next important layer which we have that is covering all these muscles inside is called as endothoracic fascia. After endothoracic fascia, now you will tell me the layer that is covering the surface of lungs. What is this layer? Pleural or parietal? What is this? Visceral or parietal layer? This is called as visceral layer of the pleura. Next, after the visceral layer, the next layer which you have over here is called parietal layer. So we have got visceral and parietal layer. So in between this visceral and parietal layer, you have got something called as what? What is this? This is called as your fluid. What is this? Pleural cavity or your pleural fluid. So first what we'll do is that we shall name all these structures and then later on we shall write down one by one. Okay. So outermost layer over here is called as your skin. Okay. After skin, the next layer over here is called as your external intercostal muscle. Next you have got is your internal intercostal muscle. Next you have got innermost intercostal divided into three. So this part over here is called as subcostalis. Okay. After that, this part over here is called as intercostalis intimus, and finally the innermost layer over here is called as your sternocostalis. After this, what is this fascia? This is called as endothoracic fascia. After this endothoracic fascia, you have got two layers. This is called as the outer, let us say the parietal layer. You have got is the parietal layer, and next you have got the inner visceral layer. Parietal as well as the visceral layer over here. Clear? So these are the structures over here. Now let us see what is this pleural tapping. How do you do this pleural tapping? First of all, we will discuss what layers you are piercing from outside to inside. Next, we will also discuss which angle you have to proceed. I mean, you should pass the needle above the rib or below the rib. So all these things we will discuss right now. So in case of pleural tap, tell me all the layers from outside to inside. The outermost layer will be your skin. Okay. After the skin, what will be the next layer which you will pierce over here? And by the way, I forgot to mention one important thing over here, that always remember below the skin after subcutaneous tissue, you will have the next layer. This is called as fascia. Everywhere it is the same. Amen. You will have fascia. Okay. After skin, you have got what? You have got fascia. After fascia, you have got a muscle called as external intercostal muscle. After external intercostal, you will have internal intercostal muscle. After intercostal muscle, now look here. If I am passing the needle in this particular way, in this particular fashion over here, now tell me what layers is it piercing? One is skin, right? Next after that we have got fascia, external intercostal, internal intercostal. And what is this muscle? This is your intercostalis intimus. Then endothoracic fascia. You're getting it? So the next layer here we have to write down is intercostalis intimus. After intercostalis intimus, you have got the endothoracic fascia. You have got your endothoracic fascia. After endothoracic fascia, the next layer you have got, what is the next layer after endothoracic fascia? You have got parietal pleura. You have got as your parietal pleura. After parietal pleura, now you have entered into your pleural cavity. Okay. So this is how you drain the pleural cavity finally. Okay. So this is how the pleural tap is done. Now you know what layers you have to pierce. Now you have to know which side actually along which border you have to pass the needle is very important. Okay. So for example, if I am drawing one rib on the top, so this is one rib on the top. Okay. Now after that we have got another rib down over here. So this is another rib on the bottom. So from outside to inside, just tell me the muscles. So outside we have got this muscle called as external intercostal muscle. After that in the center we have got as internal intercostal muscle. and here in innermost intercostal are also called as intercostalis intimus, right? So this is from outer to inner, outer to inward. Next, now what I'm telling you is that this is your external, internal, innermost. Intercostalis intimus. Now between internal intercostal and intercostalis intimus, between these you have got the neurovascular bundle. Neurovascular bundle in the sense you have got a vein over here, just beneath the rib you have got a vein, beneath that you have got an artery, beneath that you have got a nerve. Okay, so what is this? What is this? V for vein, A for artery, N for nerve. So what is the, from the top to the down, what is the neurovascular bundle arrangement? Vein, artery and nerve. See, this way of arrangement of the neurovascular bundle is for all intercostal spaces except the first intercostal space. So first intercostal space is not like this. First intercostal space is different. First nerve will be on the top, then artery, then vein. Okay, but whatever it is, always and always remember, if you are putting a needle from outside, okay, now tell me, you will put the needle below the rib or you will put the needle above the rib? Which one is safe? Is it safe to put the needle below the rib, below the lower surface of the rib, or along the upper border of the rib? Obviously along the upper border of the rib. So when you are palpating here, you palpate one rib, you palpate another rib. So you have to put the needle exactly touching above the upper surface or upper border of the lower rib. Okay, so if this is the upper rib, lower rib, upper border of the lower rib. Why? Because here we don't have any kind of neurovascular bundle over here. Okay, so this is one very important thing you have to just keep in your mind. Okay, now regarding this, I told you, I have shown you external intercostal muscles, right? So if this is a sternum in the center, I have shown you the muscles which are in this way. Downward medially is external intercostal, and upward medially is internal intercostal, and innermost intercostal I've told you three muscles. What are those three muscles? SIS. S stands for subcostalis. Subcostalis in the sense below what? Below the ribs. So these muscles are present below the ribs. So all of you just look at these muscles. So this is a rib. Below the rib you see this muscle. Below the rib you see this muscle. Below the rib you see this muscle. So these are all present below the ribs. Right here also. So these are called as subcostalis. You see below the ribs, subcostalis. And where is intercostalis intimus? Intercostalis intimus is here. One rib, second rib, the muscles which are located here are intercostalis intimus. Next important thing is, where is sternocostalis? See, this is a sternum. From the sternum all the way to the costa, whatever are attached, these are your sternocostalis. So here we have got your sternocostalis. This is called as your subcostalis, and in between them whatever you have got is a intercostalis intimus. Okay, so much more clear image you can see over here. What is this? You can see a rib on the top over here, a rib below. So this is your external intercostal, internal intercostal, intercostalis intimus. So if you can see here that there is a vein, there is an artery, there is a nerve, VAN. So you cannot puncture along the upper surface of the rib here. Along the lower surface of the rib. You have to puncture along the upper surface of the rib over here. So now we shall be discussing regarding the intercostal nerves. Okay. So topic of discussion would be regarding intercostal nerves. Now regarding these intercostal nerves, actually from where these intercostal nerves they are starting, so all of you know that this is a structure of your spinal cord. Now in the structure of the spinal cord, you know that this is your dorsal root. This is your dorsal root of spinal cord, and this is your ventral root of spinal cord. Now after this dorsal and ventral root, here you have got dorsal rami, okay, and here you have got ventral rami, dorsal rami as well as ventral rami. Now these ventral rami itself are nothing but they form your intercostal nerves. Okay, they are the intercostal nerves. So how many intercostal nerves? What are intercostal nerves? They are nothing but the ventral rami of spinal cord is called as the intercostal nerve. How many intercostal nerves we have got? First of all, we should know how many pairs of ribs are present. So basically we have got 12. We have got 12 pairs of ribs. Now in between two ribs there is one intercostal space. So 12 pairs of ribs in the sense, how many intercostal spaces are there? There are around 11 intercostal spaces. Now in each intercostal space one nerve. Then how many intercostal nerves will be there? 11 intercostal nerves. Along with 11 intercostal nerves, one extra intercostal nerve is present, that is present behind all the ribs. So when I tell a nerve is present below all the ribs, you call that as what? You call that as subcostal nerve. If the artery is present, you call it as subcostal artery. Vein, subcostal vein. Okay, so where is this subcostal nerve present? That is present below all the ribs. It means below the 12th rib. Exactly speaking, below the 12th rib. Okay, so same like ribs, we will also divide these intercostal nerves. We classify this intercostal nerves. Okay, so we classify this particular intercostal nerves into two halves. What are those two halves? One is called as the typical, another one is called as the atypical. So we divide it into two halves. One is called as a typical intercostal nerves, another one is atypical. Typical intercostal nerves are your third nerve, your fourth nerve, your fifth nerve, your sixth nerve. Third, fourth, fifth, sixth are your typical intercostal nerves. What do you mean by atypical intercostal nerves? Your intercostal nerve number 1, 2, 7, 8, 9, 10 and 11. Other than typical, remaining all are atypical. Why are you calling these as typical intercostal nerves? Because each nerve, they supply only intercostal space. They supply only intercostal space. It means third intercostal nerve supplies only third intercostal space, not fourth, not second, not fifth, not other than the intercostal spaces. Fourth will supply only fourth intercostal space. Fifth intercostal nerve will supply only the fifth intercostal space, not anything other than this. Whereas first is called as atypical. This will supply the first intercostal space and it will come out of the intercostal space and supply the other regions also. When I tell you an example, you will understand here. But let me write down these things. So atypical in the sense they supply beyond intercostal space. Supply beyond intercostal space. Supply beyond intercostal space over here. For example, let me give you few examples you will understand over here. So when I tell T1, so T1, right? So this particular intercostal nerve, it supplies where? It supplies to your intercostal space. Yes or no? The first intercostal space. After supplying the first intercostal space, it will go and join the brachial plexus. That is why in the brachial plexus, what are the nerve roots? C5, C6, C7, C8 and T1, right? So T1 is what it is. T1 is a part of brachial plexus. Brachial plexus, is it related to intercostal space? No, brachial plexus is related to the nerves of your upper limb. So how an intercostal nerve is going there till the brachial plexus? It means it is supplying that intercostal space, and then a branch of that or this nerve only, it will come out of intercostal space, go to the brachium region and take part in the brachial plexus. So it means, isn't it going beyond the intercostal space? So T1, what is T1 over here? T1 joins with your brachial plexus. Joins with your brachial plexus. Next important thing is T2. So how does T2 go here? T2 not only supplies the second intercostal space but also gives innervation to skin of axilla. Skin of axilla and what? Medial part of upper arm. Medial part of upper arm. Medial part of upper arm. Medial part of upper arm in the sense this one. Right, so it means it is giving innervation to T2 intercostal space, then it is giving its branch to the medial part of upper arm. That is the reason why whenever you have an angina, The pain will be to the left side, to the medial part of the upper arm, left side of the chest. There is not pain actually, there is tightness, right? The exact word to use is tightness. So whenever you have angina, so that tightness will be to the left side, right? Left side of the neck, left side of the arm. Why there is a referred pain? You call such pain as a referred pain. Why there is a pain or tightness to the left side? Because the T2 not only supplies the intercostal space, also comes out of the intercostal space and supplies to the medial part. Okay, so I hope you understood this. Hello guys, so now we shall be discussing regarding the intercostal arteries. Okay, so our topic of discussion would be regarding the intercostal arteries. Intercostal arteries. What are intercostal arteries? Arteries that are present within the intercostal space are intercostal arteries. There are two different types of intercostal arteries. Okay, one is called as anterior intercostal artery, another one is called as posterior intercostal artery. One is called as anterior intercostal artery, another one is called as posterior intercostal artery. So we have got both anterior intercostal and posterior intercostal arteries. Okay, now next important thing, what is the next important thing over here is that, so regarding these intercostal arteries, first of all we will discuss about anterior intercostal artery, then we will discuss about posterior intercostal artery. Before we discuss about anterior intercostal artery, one small picture I have to draw over here, explaining you how the branches of anterior intercostal artery they originally originate from. Okay, let us say that this is your aorta. Okay, this is your aorta. We have talked enough about this aorta. Here we have got the brachiocephalic trunk, here we have got the common carotid artery, and this is a subclavian artery. Okay, so this brachiocephalic trunk will divide into, one is called as a right subclavian artery, another one is called as a common carotid artery. Okay, now this subclavian artery is divided into the right subclavian and the left subclavian artery. They are in turn divided into three parts. This is the first part, second part and third part. Okay, what is this artery? Subclavian artery. Now from the first part of the subclavian artery, you see a branch that is coming down, entering into the thoracic cavity. This artery is called as internal thoracic artery. Internal thoracic artery. Okay, so this internal thoracic artery is coming from the first part of the subclavian artery. So the branches of anterior intercostal artery, they originate from where? They originate from the internal thoracic artery. Okay, so let us draw all the important branches that are located here in the anterior intercostal artery over here. Now all of you just look at this. What are these? These are the ribs. I have just drawn only 10 ribs over here. Now between two ribs there is an intercostal space. So let us say this is the first intercostal space, second and so on. So how many intercostal spaces I have drawn over here? 9 intercostal spaces I have drawn. I have to also draw one more important thing, that here I have to draw this particular artery over here called as subclavian artery. What did I tell? Subclavian artery is divided into three parts. This is called as the first part, second part and third part. Now first part of subclavian artery gives out a branch. This is called as your internal thoracic artery. This is what I told you. Internal thoracic artery, right? Now what is going to happen with this internal thoracic artery is this internal thoracic artery descends down all the way. You see it is descending down. So it descends down all the way till the sixth intercostal space. Okay, it descends down all the way till the sixth intercostal space, and in the sixth intercostal space this internal thoracic artery is divided into two branches like this. You see it is divided into two branches. So one branch, this branch over here is called as superior epigastric artery. Superior epigastric artery. What is the other branch? The other branch is called as musculophrenic artery. You see the next branch is coming down. This particular branch over here is called musculophrenic artery. Okay, musculophrenic artery, which supplies to your phrenic artery, which supplies to your diaphragm. Okay, all of you know that here we have got a diaphragm. Now remember one thing, that in each intercostal space, now from where, first of all, from where does these intercostal arteries arise? These intercostal arteries are arising from the internal thoracic artery. So in each intercostal space there are two anterior intercostal arteries. Okay, so in the first intercostal space, how many anterior intercostal arteries? 2. Second intercostal space also we have got 2. Third intercostal space also we have got 2. Okay, you see we have got two arteries over here. Next, fourth intercostal space we have got two anterior intercostal arteries. Fifth intercostal space also we have got two anterior intercostal arteries. Now when it comes from the seventh intercostal space, in the sixth intercostal space there are no branches. Why? Because the main internal thoracic artery itself is dividing into two branches. Right? Now what happens with the remaining anterior intercostal arteries? Now anterior intercostal arteries, they originate from the seventh intercostal space, that is from the musculophrenic artery. You see the remaining branches are given by the musculophrenic artery like this. Clear? So remember one thing, till the sixth intercostal space, who is giving two anterior intercostal arteries? These anterior intercostal arteries are given by internal thoracic artery. From the seventh intercostal space, who is giving these anterior intercostal arteries? These are given by your musculophrenic artery. Okay, so this is one of the very important thing you need to remember. So what did we just learn here? We learned that till sixth intercostal space, all these in anterior intercostal arteries are given by internal thoracic artery. Okay, now from seventh intercostal space, these are given by what? Musculophrenic artery. These are given by musculophrenic artery. So internal thoracic artery gives how many anterior intercostal arteries? It gives two anterior intercostal arteries. In the same way, musculophrenic artery gives how many? It also gives two anterior intercostal arteries. Okay, so these are the important things you need to know. So if you can look at this particular picture over here, so you can see that there are three parts. Okay, first part, second part and third part of subclavian artery. From the first part of subclavian artery, internal thoracic artery is coming down, and in the sixth intercostal space, as I told you, it is dividing into two branches. One is called superior epigastric, one is called as musculophrenic. So till sixth intercostal space, in each intercostal space, how many anterior intercostal arteries are given? Like this two. Okay, after that your musculophrenic artery is the one which will give your anterior intercostal arteries. This is one of the very important thing. Okay, next important thing, what is the next important thing is that, as you can look at this particular picture over here. Okay, what is this particular picture? So normally if you see, this is your right coronary artery and this is your left this part is your left coronary artery. Let us say a branch of left coronary artery is called left anterior descending artery. Okay, let us say that there is a block over here. Okay, so there is a block here. Clear? So there is a blood clot over here. Now when there is a block here, do you think from the left coronary artery the blood will pass down to the apex of the heart? No, blood will not pass. So what will happen? Obviously this area will lead to infarction. Okay, so this entire area will lead to infarction. So what you basically do is that you see here, this is your subclavian artery. First part of subclavian artery is your internal thoracic artery. This is your internal thoracic artery, right? Now what they are doing is that they are putting this internal thoracic artery, they are attaching it all the way to the coronary artery. It means, what are they doing? They are bypassing. For example, let us say that this artery over here is called as your coronary artery. Now this coronary artery is having a block over here. Now when there is a block over here, how do you think the blood vessel is, how do you think the blood flows over here? In this way. You see, the blood is coming all the way, it is taking a turn, right, and then the blood goes in this way. Now what is this vessel that you have attached over here? This vessel is nothing but a bypass vessel called as internal thoracic artery. Okay, this is called as internal thoracic artery, or you can call it as internal mammary artery. Okay, so this is the bypass that I have created. So this is the same bypass, and here it will be very clear to you understand. You see, there is a blockage over here. Because of this blockage, what is happening? Blood cannot descend down. So obviously you are creating a bypass all the way from the top till down over here. Okay, so this kind of bypass is created where? In the coronary artery. coronary artery. That is why you call this bypass as coronary artery bypass grafting, CABG. What is this CABG? Coronary artery bypass grafting. So this kind of grafting over here you called as coronary artery bypass grafting. So for coronary artery bypass grafting, what are the two important vessels you basically use? One is called as a great saphenous vein. One is called as a great saphenous vein. Another one just now we discussed, that is internal mammary artery. You can call it as internal mammary artery or internal thoracic artery. Both of them are the same. So this is all the discussion about your anterior intercostal arteries. Okay, so this is all the discussion about your anterior intercostal arteries. Now we shall discuss about the posterior intercostal arteries. Okay, so our topic of discussion would be regarding the posterior intercostal arteries. Okay, now regarding this posterior intercostal arteries, what is the important thing you have to know? Again, let me draw down the same picture over here. Let us say this is your arch of aorta and this is your descending part. This is your descending part over here, right? Now, so this artery descends down all the way, and let me also draw that this is your diaphragm over here. Clear? Now, next important thing is, let us say that here you have got what is this? This is your brachiocephalic trunk. Dividing into what is this? This is called as your right subclavian artery and common carotid artery. Right subclavian and common carotid artery. Okay. Now what I am telling you is that this particular subclavian artery is having a very small branch over here. Okay. So this branch of subclavian artery is called as costo-cervical trunk. What is this branch called as? Costo-cervical trunk. This branch is called as costo-cervical trunk. Now this particular costo-cervical trunk, what is it doing? It is giving out a branch like this. This costo-cervical trunk is giving out a branch. So this branch that is given out by this costo-cervical trunk is called as superior intercostal artery. Okay, what is this branch called as? Superior intercostal artery. This superior intercostal artery gives off two branches, 1 and 2. What are these two branches? This is called as a first posterior intercostal artery. This is called as the second posterior intercostal artery. So you have to know here is that first and second posterior intercostal artery. Okay, posterior intercostal artery, these two branches are given by whom? These two are the branches of superior intercostal artery, and superior intercostal artery is in turn the branch of costo-cervical trunk, and costo-cervical trunk is in turn the branch of subclavian artery. Next important thing, what is the next important thing is that all the way from third, right? All the way from the third, you see here, third, fourth, fifth, sixth, seventh, eighth, 9, 10 and 11. Okay, so all the way from the third till 11th, all these posterior intercostal arteries, they are directly emerging from your thoracic aorta. Okay, so you know this is your thoracic aorta, right? So 3, 4th, 5th, this is 6th posterior intercostal artery, 7th posterior intercostal artery, 8th posterior intercostal artery, 9th, right, and 10th posterior intercostal artery. So what you have to write it down, all the way from 3rd till 11th, right? These directly arise from what? They directly arise from the descending aorta. I mean your descending thoracic aorta. Okay, now look here, there are two other arteries. Okay, let me draw it with another color. Yeah, see, there is one artery down here, one artery down here. These arteries are present below all the ribs, so that is why you call this as subcostal artery, which are present below all the ribs, I mean below your 12th rib. Okay, that is called as your subcostal artery over here. So these are the important arteries which you need to know regarding the anterior intercostal and the posterior intercostal. So once again, so anterior intercostal artery, from where does it originate basically? Right, anterior intercostal arteries, they originate from internal thoracic artery. Internal thoracic artery is a branch of subclavian artery. So as I told you, subclavian artery is divided into 1, 2 and 3 parts. From the first part of subclavian artery, you see internal thoracic artery is coming down. This internal thoracic artery is giving two anterior intercostal arteries in each space. So what are these arteries over here? Anterior intercostal arteries in each intercostal space. When it comes to the 6, it divides into 2. Okay, it divides into 2. Divides into 2 all the way down here. Now from the 7th intercostal space, you see 2 arteries that are given over here. Okay, right. So these are the branches here. Now when it comes to the posterior intercostal arteries, what did I tell you? The first and second posterior intercostal arteries, they are directly coming from the branches of superior intercostal artery, which is in turn costo-cervical trunk. Whereas third, all the way from the third, okay, all the way from the third till 11th, it is directly coming from the aorta. Okay, so these are the branches of anterior and posterior intercostal arteries. So now we shall be discussing regarding the venous system, okay, the veins of the thorax. So basically we have got two important venous systems over here. One is called as azygous and the other one is called as hemiazygous. Azygous and hemiazygous veins. So azygous is a complete vein, hemiazygous is a half of it, okay. So we'll discuss about these things in a minute now. So coming to this azygous and hemiazygous, first of all you have to remember one thing, that here we have got a vein over here. This particular vein over here is called as your brachiocephalic vein. This is your right brachiocephalic vein, okay. Now in the same way, here you have got the left brachiocephalic vein. So this is your right brachiocephalic vein over here, okay. Right. So important thing you need to know over here is that, see here what we have over here is called as a right brachiocephalic vein, right, and this one over here is called as a left brachiocephalic vein, right and left brachiocephalic vein, okay. So what are the two cephalic veins we have got over here? One is called as a right brachiocephalic vein, this is called as your left brachiocephalic vein. So brachiocephalic vein on the right and left together they form what? Superior vena cava, okay. So this venous system over here is called as your superior vena cava, okay. Now draining into superior vena cava, draining into this superior vena cava, we have got a vein like this, okay. So this is a vein that is draining into your superior vena cava. So this particular vein over here is called as azygous vein. So what is this particular vein over here? You call this as azygous vein, azygous vein, okay. Now draining into azygous vein, there are two other veins, okay. So what are those two other veins which are draining into azygous vein? See, this is one particular vein. This is one particular vein which is draining into your azygous vein, and in the same way this is another vein over here, right. So even this vein also drains into your azygous vein. So one you call it as hemiazygous, this is called as hemiazygous vein, and this one over here is called as accessory hemiazygous vein. We have got the hemiazygous, another one we have got is an accessory hemiazygous vein. So these are the important things: azygous, hemiazygous and accessory hemiazygous. Next important thing is if you look how the veins are draining, these are all the veins which I will be drawing right now are the intercostal veins, okay. Let us say the first intercostal vein, okay, the first intercostal vein directly drains into the right brachiocephalic vein. In the same way, the first intercostal vein on the left side also directly drains into your left brachiocephalic vein. So first intercostal vein on the right side is directly draining into right brachiocephalic vein. On the left side, the intercostal vein directly drains into the left brachiocephalic vein. Next, what is happening? Next, what is happening is that intercostal vein number 2, intercostal vein number 3 and intercostal vein number 4, 2, 3 and 4, all these veins they join together. Intercostal vein number 2, 3 and 4, all of them they join together and form a single vein like this. This single vein is called as right superior intercostal vein. This is called right superior intercostal vein. And this right superior intercostal vein drains into what? It drains into your esophagus vein. Okay. Now on the left side what is happening? Let us see. On the left side also there is intercostal vein 2, left intercostal vein 2, left intercostal vein 3, left intercostal vein 4. Again here also all of these three join together and they form a vein over here, and here it was called right superior intercostal. Here I am calling it as left superior intercostal vein. Now this left superior intercostal vein comes all the way and drains into again your, what is this? Left brachiocephalic vein. So into the left brachiocephalic vein, how many veins are draining? 5 veins are draining. Sorry, 4 veins are draining. One is the first intercostal vein onto the left side. Next is 2, 3, 4 intercostal veins. They are first draining into left superior intercostal vein, and this left superior intercostal vein is draining into left brachiocephalic vein. Okay, so these are the things. Now coming to on the right side, coming on to the right side, we have got the 5th intercostal vein, we have got the 6th intercostal vein, we have got the 7th intercostal vein, 8th intercostal vein, 9th, 10th and 11th intercostal vein. All these intercostal veins, where are they draining? They are directly draining into your esophagus vein like this. All of them are draining into your esophagus vein. Let us look at the other side. Here also we have got 5th, here also we have got 6th, 7th and 8th, 5th, 6th, 7th, 8th. So all of them are, where are they draining? They are draining into accessory hemiesophagus vein. They are draining into accessory hemiesophagus vein. Now after 8th, what are the next things left? 3, only 3 are left, right? 9, 10 and 11. So these 9, 10 and 11, where are they draining? They are draining into your hemiesophagus vein like this. They are draining into hemiesophagus vein. So these are the veins which you have to remember. What are the veins that are draining into esophagus vein? What are the veins that are draining into accessory hemiesophagus? What are the veins that are draining into hemiesophagus? Okay, so these are some of the important things. Now when you come down over here, here you call this one as a superior vena cava, right? So this is your superior vena cava. Okay, this one was your superior vena cava. In the same way down here, you will have a vena cava called as what? Inferior vena cava, obviously. So here you have got a vena cava by name inferior vena cava. Let us say that this is your IVC, inferior vena cava. Now this inferior vena cava is having two important openings. Two important veins are draining into this inferior vena cava. What are those two important veins? See, one is called as a right renal vein. Another one over here is called as your left renal vein. What are these renal veins? This is called as a right renal vein. This is called as a left renal vein. Right renal vein and left renal vein. Right and left renal vein. Okay, now look here, another important thing over here. What is this important thing? What is this important thing is that, right, now another important thing is that there is a vein that is draining into esophagus vein. There is another vein that is draining into esophagus vein. There is a third vein that is starting from inferior vena cava and it is joining this particular vein over here. So what are these three veins? I am telling you that these three veins are A, B and C. Let us look onto the right side. On the right hand side also, you see a vein directly draining into, what is this? Hemiesophagus vein. Okay, you see another vein directly draining into hemiesophagus vein, and another vein coming from the left renal vein drains into your vein number B. So what are these veins? Here A, again here B, again here C. What is the difference? A, B are same. But look at C, one C on the right side is originating from the inferior vena cava, whereas the other C is coming from your left renal vein. It is a branch of your left renal vein. Okay, so what are these three important branches over here? What are these three important branches over here? These are, the first A here is right subcostal vein. Right subcostal vein. Okay, if that is right subcostal vein, then this will be called as left subcostal vein. One is right subcostal, another one is left subcostal. Next, B is a right lumbar ascending vein. Lumbar ascending vein. Here B is left lumbar ascending vein. Right lumbar ascending vein. This is left lumbar ascending vein. Next, what is C over here? C is called as right lumbar azygous vein. Right lumbar azygous vein. Then tell me what will be this called as? Left lumbar azygous vein. Left lumbar azygous vein. Left lumbar azygous vein. Okay, so these are some of the important things. So if you want to remember the picture, it is well and good. If you don't want to remember the picture, then remember this text which I am writing right now. That is the right superior intercostal vein. Where does it drain into? It drains into your azygous vein. It drains into your azygous vein. In the same way, left superior intercostal vein, where does it drain into? Will it drain into azygous? No. It will drain into your left brachiocephalic trunk. Brachiocephalic trunk. Right? Brachiocephalic trunk. Next important thing is that on the right side, all the way from the 5th intercostal vein till the 11th intercostal vein, where are they draining into? They are again draining into azygous vein. In the same way, on the left side, from the 5th intercostal vein till 8th intercostal vein, where are they all draining into? They are draining into accessory hemiazygous vein. They are draining into accessory hemiazygous vein. In the same way, the left side, all the way from 9th till 11th intercostal veins, they drain into what? They drain into your hemiazygous vein. So these are the important venous drainage systems which you have to remember over here. Okay, so now we shall be discussing regarding the pleura and its recess. Okay, that is our pleural recess. So what do you mean by recess? Recess is nothing but the expanded regions of the pleural cavity is called as a recess. So before we discuss about the pleural recess, first of all we have to know how many types of pleura we have got. Okay, obviously we have got parietal and visceral, but based upon its location, the pleura are divided into 4 different types. Let us say this, let me show up this thing to you. Right. So now if you look over here, that this is the lung. Okay. Now attached to the lung, the pleura whatever you have got over here is called as visceral pleura. Attached to the lung, the pleura whatever you have got over here is called visceral pleura. Now after this visceral pleura, next the pleura which you have got over here is called as your parietal pleura. What is this? This is called as your parietal pleura. So how many types of pleura you have got? Visceral pleura and parietal pleura. All of you know that here we have got our ribs. Okay, and you should also know that here we have got intercostal muscles, external intercostal, internal intercostal, innermost intercostal. Again, external, internal, innermost, external, internal, innermost. I have discussed this previously, right? External, internal and innermost. Next, down here obviously you have got right hemidiaphragm, on the left side you have got the left hemidiaphragm. So all of you look here now, right? If a pleura is present between, right, okay, let me write these things down, that this particular pleura over here is called as parietal pleura, parietal layer, and this one over here is called as a visceral layer. So pleura, how many types they are divided over here? So if you look closely, there is a pleura that is present in the cervical region. See on the top, the pleura which is present on the top here, this kind of pleura is called cervical pleura. This part of the pleura which is present on the top is called as cervical pleura. I am just writing it as number 1. Okay. Next, now you will tell me what is the name of this pleura which is facing your costal cartilages or your ribs. The pleura that is facing your ribs or the costal cartilages over here, right? This pleura is pleura number 2, right? This is called as costal pleura. What is this pleura called? Costal pleura. After that, you have got pleura that is present down over here. Down where? Down facing your diaphragm. Okay, so you see a pleura that is facing down to the diaphragm over here. This pleura is called as diaphragmatic pleura. And finally, you have got another type of pleura that is present towards the midline in the sense mediastinum. You see this part over here, this area over here is called mediastinum. So this is facing your mediastinum. So such kind of pleura you call it as a mediastinal pleura. So this is pleura 3, this is pleura 4. Okay, so once again, how many pleuras we have got? 1, 2, 3 and 4. We have got 4 important types of pleura. The first pleura over here is called as cervical pleura. What do you call it as? You call it as cervical pleura. Second important pleura, you call it as costal pleura because they are placing the costal cartilages and the ribs. Third important pleura is facing down to the diaphragm, called as diaphragmatic pleura. This is called as what? Diaphragmatic pleura. And fourthly, we have got mediastinal pleura. Okay, mediastinal pleura. Now, out of all these pleura, you have to know the first 3 pleura over here, they are innervated by which nerve? They are innervated by intercostal nerve. Intercostal nerve. All the first 3 are innervated by intercostal nerve, whereas the last 4th one is innervated by what? It is innervated by phrenic nerve. It is innervated by phrenic nerve. First 3 by intercostal nerve, 4th one is by phrenic nerve. Now, what do you mean by pleural recess? Expanded regions of pleural cavity. See here, the pleural cavity over here is maintaining a same diameter, right? Yes or no? The space between visceral and parietal pleura is maintaining a same diameter all the way down, the same gap all the way down, right? You see, it is maintaining a same gap over here, but there are some locations where the parietal pleura and visceral pleura are expanded, right? So those are called as pleural recess. Anyways, when I draw, you will understand, but for that you just need to write this thing down, that the expanded, what is this? Expanded regions. Expanded regions of what? Pleural cavities. Expanded regions of pleural cavities, you call it as what? Pleural recess. You call it as pleural recesses. Expanded regions of pleural cavity is called as pleural recesses. So let us learn what are the different kinds of pleural recesses you have got over here. Let us say this is your lung. Okay, and let me draw that here you have got this pleura called as visceral pleura, which is attached to the closed surface of your lung. This is your visceral pleura. After that, you have got another pleura called, now I am telling you about another pleura that is called as parietal pleura. So all of you look here, this is a parietal pleura. Now this parietal pleura is even, and down here you have got a recess, you see. And in the same way, even, and down here you have got another recess. Now parietal pleura all over it is same, but at one particular region in the sense, let us say exactly at here, the visceral pleura and the parietal pleura, they are separated, they are expanded. Here also the visceral pleura and the parietal pleura are separated or expanded over here. What is this kind of expansion called as? This particular expansion is, and by the way, down here you have got diaphragm, right? And by the way, you have got what here? You have got ribs on both the sides here. Ribs with external intercostal, internal intercostal and innermost intercostal. Okay, so what is this recess? This recess is present between the costa on one side and diaphragm on other side. So this recess that is present in the angle of costa on one side and diaphragm on other side is called as costodiaphragmatic recess. This is called as costodiaphragmatic, not bragmatic, it is H, diaphragmatic recess. Okay, and all of you know that this area over here is called as your mediastinum. Why? Because this is the place where your heart is located. right? Mediastinum. So this particular recess over here is called as costomediastinal recess. Costomediastinal recess. So how many types of recess we have got? One is called as costodiaphragmatic recess, another one is called as costomediastinal recess. Now let us say out of these two, which is the most dependent part? Dependent part in the sense, if fluid has to accumulate, where it will accumulate more? What do you think? Fluid will accumulate more in the costodiaphragmatic recess, okay, because it is more downwardly projected. So this is a place which is called as the most dependent area. Most dependent area. Okay, so for example, if there is excess amount of fluid that is accumulated within the costodiaphragmatic recess, let us say if the fluid, if excess fluid accumulates, if the excess fluid accumulates over here, you call this particular condition as pleural effusion. You call this particular condition as what? Pleural effusion. Okay, you call this particular condition as pleural effusion. Now in such cases of pleural effusion, what you need to do? You need to drain the fluid out, right? So draining that fluid out is called as pleural tap. What do you call it as? Pleural tap. So for pleural tap, what do? You have to insert a needle. Where will you insert a needle? You will insert a needle in the mid axillary line, in the 8th intercostal space. Okay, so you would insert a needle in the mid axillary line, in the 8th intercostal space. So this is the place where you insert the needle over here. Next important thing you need to understand over here is that if you look at parietal pleura and if you look at visceral pleura, right? Parietal pleura is pain sensitive because there are pain receptors located here, pain sensitive. But whereas visceral pleura is not having a pain receptors, so it is pain insensitive. Okay, right. So whenever there is a fluid that is accumulated, look at the lung over here. This is the left lung, which is perfectly normal. But look at the right lung. You see the right lung has to be all the way here. And by the way, remember one very important thing, that you see this line over here, this line, dome shaped line. This dome shaped line is nothing but left hemidiaphragm. But what about the right hemidiaphragm? There is no right hemidiaphragm. Why? Because you know now I will show you, right, that here we had got a pleura like this, right? Outside also we have got a pleura, but here right now within this pleura, a lot of fluid is accumulated. You see a lot of fluid getting accumulated, and this fluid pushes this pleura upward. So what will happen when the pleura is pushed upward? The parietal pleura also is pushed upward like this. Okay, now when the parietal pleura is pushed upward, you see a lot of gap now. So in this gap a lot of fluid accumulates, and this parietal pleura is attached to the lung, so even the lung also is compressed. Okay, so this is what happens. So whenever you see such x-ray, always put it as pleural effusion. Look at this x-ray here. Again, here also you see right sided pleural effusion, here you see left sided pleural effusion, right? Again, here you see left sided pleural effusion. You see a curve. If you see a perfect curve like this, right, then put it as a pleural effusion over here. Yeah, so this is what is pleural effusion. Okay, another important concept I just want to tell here to you is that, see, let me draw the lung again. So this is the lung over here, and all of you know that here we have got the visceral pleura, right, and outward we have got over here is a parietal pleura. Normally we have got the pleural fluid within this, and normally the pressure within the pleural cavity is negative pressure. Okay, and let me also draw these intercostal ribs over here, intercostal muscles, right? Let us say someone with a knife has punctured your chest. Now when someone with a knife has punctured the chest, and this is the chest wall, okay, let us say someone with a knife has punctured the chest. Now someone with a knife, when they puncture the chest, what is going to happen? You know that the air will enter all the way into the lung. You see, this is the entry of the air. The air is entering into the pleural cavity. Once the air enters into the pleural cavity, don't you think pleural cavity is normally negative? Once if there is a small opening, don't you think this negative pressure will suck all the air inside? When it will suck all the air inside, there will be excess amount of air within the pleural cavity. Now this excess amount of air, what it is actually doing to your lung? It is actually compressing your lung. Okay, you see? And this entirely is the oxygen. I mean, this entirely is the air that is present here that is compressing your lung. Now tell me, in previous case also, like pleural effusion, there is compression of lung because of fluid, but here compression of lung is happening because of what? Because of air. Now how different you will see the x-rays there. If in case here, if there is a fluid, the fluid looks white on x-ray. That is why you can see a white color covering along with the compression of the lung. But how do you see an air? Air looks black. How do you see then if there is excess amount of air over here? This area will be black, lungs always will be black, right? So how will you differentiate? How will you differentiate is, look here. This is not a normal x-ray. This is not a normal x-ray. Look at the x-ray clearly over here. Now here, can you see some white color lines? These white color lines are going all the way till the periphery, right? You see this white color, all zigzagness of these lines, right? These are called as bronchograms. So these lines are going all the way till the periphery. But look onto the left side. Left side, see here I have got this whitishness, but here there is no white color. It is pure black. You see, there is not even a single white color line which you can see here also. I cannot see a single white color line over here. Why? Because this area is completely having air, and this air has pushed the lung inside like this. Clear? Look at the next x-ray. Look at this x-ray. Now here can you see these white color lines in the form of branches all the way till the periphery? I mean periphery in the sense till the end of the lung. You see here? White color lines all the way like a network. And down here you see all the lines that are going like a network. On the right side also you can see all these white color lines. But tell me, can you see the white color line here? No. Here I don't see any white color line. See, I'm zooming in. Can you see any white color line? No. But the same place, look on the opposite side. Can you see all this whitishness? There is. And here there is no whitishness. Here there is no white color lines. Here there are no lines over here. So which means that patient is having this right-sided pneumothorax. Very clearly you can even see the lung border also. You see this? You see this lung border here? Right-sided pneumothorax. And what is this kind of pneumothorax over here? So here the upper lobes of the right side are fine, the upper lobes of the left side are fine, and here also it is fine, here also it is fine. So this is a normal x-ray. Okay, so these are some of the important x-rays that you have to basically identify. So now we shall be discussing regarding the root of the lung. What are the structures that are present in the root of the lung? Okay, so you can see this is the medial surface of the lung. Okay, this is the medial surface of the lung. And you can see that this particular part over here is called as the root of the lung. Okay, so if you look at the lung here, this is your right lung, this is your left lung over here. So this surface of both the lungs over here is called as the root of the lung. Okay, so if you look at the root of the lung, what is the shape of the root of the lung, guys? The root of the lung shape is somewhat like this, right? Right. So what we'll do is that we will draw down the shape of the right lung as well as the left lung, and then study the structures that are located in the root, okay, or in the hilum. What do you call it, as a hilum or whatever it is? Okay, so this is the right lung over here and this is your left lung over here. Okay, right. Let us say this is the particular root of your lung. Now in this root of the lung, what are the important things you can see? On that, and by the way, let me write this thing down, that this is your right lung. Okay, this is your right lung, and here you call it as a left lung. So one is your right lung and the other one over here is called as your left lung. Now when it comes to the right lung, here I have got an artery over here. This artery is called as bronchial artery. What is this? Bronchial artery. Now if you look at the root of the left lung, how many bronchial arteries you have got? So one on the top, one on the bottom. You have got two bronchial arteries. Okay, so what is this particular artery over here? This artery over here is called as bronchial artery. So how many bronchial arteries we have got in the right lung? One. How many bronchial arteries we have got in the left lung? Two. Okay, we have got two bronchial arteries on the left lung. Next, above the bronchial artery, you have got bronchus. Below the bronchial artery also you have got bronchus. So how many bronchi are located in the right lung? Two. So how many bronchi are located in the left lung? Only one. Okay, you see artery is one, and artery is one on the right and two on the left. And when it comes to bronchus, bronchi are two on the right, one on the left. So 1:2, and there it is 2:1. Okay, so this bronchus that is present, above the artery is called epiarterial bronchus or eparterial bronchus. Eparterial bronchus. Why? Because this bronchus is present above the bronchial artery. Next, this bronchus over here is present below the bronchial artery. You call this as hyparterial bronchus. Hyparterial bronchus. One you call it as a heparterial bronchus, another one you call it as a hyparterial bronchus. Next, you have got the artery. What are the arteries that are located? Here I have got an artery called as right pulmonary artery. Here I have got an artery called as left pulmonary artery. Okay, so how many pulmonary arteries I have got? One on the right, one on the left. Okay, so this artery is called as a right pulmonary artery, and this one over here is called as a left pulmonary artery. You have got the right pulmonary artery, you have got the left pulmonary artery. Now when it comes to the pulmonary veins, here you have got the right pulmonary veins, here you have got the left pulmonary veins. So these are the two what do you call as right pulmonary veins, right pulmonary veins, and these are the two left pulmonary veins. These are the two left pulmonary veins. So what are the structures that are located on the right as well as on the left? The only main important difference you need to know, on the right side you have got only one bronchial artery, left side you have got two bronchial arteries. On the right side you have got two bronchi, on the left side you have got only one. So you see a triangle like this, right? So this is the thing you need to remember. Next, you can see right pulmonary artery, left pulmonary artery. Next, you can see two pulmonary veins on the right, two pulmonary veins on the left. And down here you have got a ligament. You see this particular ligament over here. This ligament over here is called as pulmonary ligament. What is this? This is called as your pulmonary ligament. Okay, so these are the structures which you have in the root of the lung. Okay, so these are the structures which you have in the root of the lung. Now let us discuss about the lungs and bronchopulmonary segment. The lungs, its bronchopulmonary segments. Lungs and its bronchopulmonary segments. When it comes to the bronchopulmonary segments, first very important thing you need to know is that here we have got this particular thing is called as your right bronchus, and this is called as your left bronchus. Okay, and this is your lung over here. Okay, and very important thing you need to know is that if you look at the right bronchus is short, and is it narrow or dilated? You see it is dilated over here. Okay, wide. Whereas left bronchus is short, right? Left bronchus is long and very narrow. Yes or no? So if there is a foreign body here, tell me where most commonly it can pass. Obviously it will enter into the right bronchus. So one important thing you need to know over here is that the right main bronchus obviously, the right main bronchus is short plus wide. Okay, in the same way the left bronchus is long plus narrow, short and wide, and here it is long and narrow. So because of this short and wideness and long and narrow, so here most commonly aspiration happens here. Most common aspiration of foreign objects. Aspiration of foreign objects will happen over in the right bronchus. Next important thing is that if you look at the right side, right, and by the way this is your right lung, this is your left lung. Right lung is having how many lobes? 3 lobes. How are you dividing the right lung into 3 lobes? Here I have got a fissure. This fissure is horizontal, so I am calling it as horizontal fissure. Next you have got another fissure like this. This is called as oblique fissure, right? So what are these two fissures? Here there is a fissure called as horizontal fissure, and here the fissure is called as oblique fissure. In the same way, I have got another fissure over here. This is called as your oblique fissure. Oblique fissure. So So do you have any horizontal fissure on the left side? No. On the right side, do you have? Yes. On the right side, what are the fissures that are located? We have got horizontal fissure which is dividing the right lung into upper lobe and middle lobe. We have got oblique fissure which is dividing the right lung into middle lobe and lower lobe. Whereas on the left side, we have got oblique fissure which is dividing the lung into upper lobe and lower lobe. So on the right side, we have got 3 lobes. On the left side, we have got 2 lobes. Okay. Now each lobe is having segments called as bronchopulmonary segments. Okay. So this entire right lung is having how many bronchopulmonary segments? That is important to know. This entire right lung is having around 10 bronchopulmonary BP segments. The same goes here. Here also there are 10 bronchopulmonary segments. So how many bronchopulmonary segments on both the sides? We have got 10 bronchopulmonary segments on the right. We have got 10 bronchopulmonary segments on the left. Okay. Now how are they divided? Here 3 bronchopulmonary segments are on the top, 2 bronchopulmonary segments in the middle. So totally kitna ho gaya? 5, and down here we have got 5. How on the left side? 5 on the top, 5 on the bottom. Okay, so let us learn what are the names of these bronchopulmonary segments. But before that, you have to remember one very important thing. Who is supplying the air to the bronchopulmonary segment? We have discussed primary bronchi, secondary bronchi, tertiary bronchi, terminal bronchi, all these types of bronchi. So in that, the bronchopulmonary segment is aerated by Who is supplying the air to the bronchopulmonary segments? That is your tertiary bronchus. Okay, that is your tertiary bronchus which is supplying the air to the bronchopulmonary segment. Clear? Now let us write down all the names of these segments. So let us say this is your right lung, and let us say this is your left lung over here. Now for conventional purpose, what I am doing is I am dividing the right lung into 3 lobes in this way, left lung into 2 lobes like this. Okay. Now look here, what are the bronchopulmonary segments? Here there are 3, here there are 2, here there are 5. Here there are 5, and here there are 5. Okay, so let me put this line a little bit up over here so that it would be easy. Yeah. Now let us write down all these segments. First, now tell me, what is the apex and base of the lung here? See, this is called as the apex of the lung. This is called as the base of the lung. So the first segment here I have to write is apical segment. Apex is always having apical segment. After that, the next segment which we have over here is called as posterior segment. Opposite of posterior will be anterior. Clear? Next, coming to 2, there are 2 segments called as, one is called lateral, one is called as medial. One is called lateral, one is called as medial. Coming to the lower 5 segments, remember the mnemonic SMALP, that is SMALP, SMALP. What do you mean by SMALP? Tell me, what are the different surfaces, borders, whatever it is, what are the different sides do we have? We have got superior, we have got inferior, we have got anterior, posterior, lateral, medial, all of you know this. Now S stands for what? Superior. M stands for what? Medial. A stands for what? Anterior. L stands for what? Lateral. And P stands for what? Posterior. So you have to write this as superior, medial, anterior, lateral, and posterior. Now what is all this part? Apex or base? What is this called? Base. So what you have to write it as? Superior basal, medial basal, anterior basal, lateral basal, and posterior basal. Okay, so these are the segments which you have to remember on the right side. Now when it comes to the left side, what are the different kinds of bronchopulmonary segments? See, here also we have got an apex, we have got a base. So apex always, what segment is that? Apical segment. Apex always takes the apical. After apical, what was the next segment that has to be there? Posterior. Right? After posterior, what should be there? Anterior. We should have anterior. After anterior, what should be there? Here lateral and medial, right? But not lateral and medial here. Here you have to write it as superior lingual and inferior lingular. superior lingular and inferior lingular. I mean tongue shaped. There is a small lobe in the form of a tongue shape. So that is your superior and inferior lingular. Now coming to the lower 5. What are these lower 5? Again S, M, A, L, P. Okay. Again put all the 5 on the right hand side to the left side. Okay. So this is your right lung and this is your left lung. Clear all of you? So what is the important thing you need to just remember is apical posterior anterior is easy to remember. Only thing which you need to remember here is on the right side you have got lateral medial, on the left side you have got superior lingual and inferior lingual. This is the only thing new that you have to remember over here. Now we shall be discussing regarding the pericardium. Okay. So topic of discussion would be regarding the pericardium. So what is pericardium? First of all, let us discuss what are the functions of pericardium. So basically, we have got two types of pericardium, right? One is called fibrous pericardium, another one is called serous pericardium. Pericardium is nothing but the layers that are covering your heart. Okay, so think these pericardium same like pleura, but there are slightly different things to add on here, right? So pleura also we have got parietal pleura, visceral pleura. Here also we have got parietal pericardium, visceral pericardium. Pleura we have got pleural cavity. Here we have got pericardial cavity. So whatever it is, first of all, if you look at the functions of pericardium, what are the functions of pericardium in the sense? So let me draw a very basic picture. Okay, let us say this is your heart and this is a blood vessel that is going out of the heart. Now what I am telling you is that covering this heart there are some layers like this. Okay, covering this heart there are some layers. So these layers which are covering the heart, all of them together they are called as pericardium. Okay, so there is a green color layer and there are two blue color layers here. So whatever it is, all of them are protecting your heart. Yes or no? So first important thing what I can tell you is that now if heart wants to move freely, can it move? No. So it can move but not excessive movements. Yes. So what is the function of pericardium is that this pericardium which is covering the heart in the center, it will restrict the heart movements. Okay, it will restrict the excessive movements of the heart. So the first function is it will restrict the excessive movements of the heart. Second important thing, what is the second important thing over here is that within the pericardium you have got the pericardial fluid and all of this. So this entire, it is like a container. This container is completely lubricated. Okay, so why do you need this lubrication? So that the heart can relax and the heart can contract smoothly. Okay, so what I have to write here is that this serves as a lubricated container in which heart can contract and relax smoothly. So this serves as a lubricated container, in which heart contracts and relaxes smoothly. Third important thing, what can happen is that it will limit the cardiac distension. Okay, if heart wants to enlarge, right, if there are no coverings around the heart, heart will enlarge. If there are coverings around the heart, obviously heart can only enlarge till a limited area, right, it cannot distend more. So this will limit what? Cardiac distension. This would limit your cardiac distension. Okay, next important thing over here is that if you look at the heart, so let us say this is your developing heart with the 4 chambers. Okay, now in this developing heart, let us say that this is a layer that is surrounding the heart. Okay, you see this layer? So this is a layer that is surrounding your heart in this way. Okay, surrounding this layer there is another layer. That is surrounding the heart in this way. Okay, so these layers whatever I'm drawing right now, they form the pericardium. So here what is the important thing you need to understand? Important thing you need to understand is that the first layer which I've drawn, this blue color layer, is nothing but called as your serous pericardium. Okay, so let me finish up this, then I will explain you clearly what is this. I just want you to differentiate, and that is the reason why I'm drawing these colors over here. Now, the black color layer which I've drawn on the top, right? So this is called as, made up of a fibrous sheath called as fibrous pericardium. This is called as fibrous pericardium. After fibrous pericardium, this blue color layer over here is called as serous pericardium. One is called fibrous pericardium, another one is called as a serous pericardium. So outer, what do you have? Outer you have got fibrous pericardium, and inner, what do you have? Inner you have got your serous pericardium. Now what is happening is that as the heart is enlarging, right? So what will happen as the heart is enlarging? This heart will push the serous pericardium down here. Right, so initially what I'm trying to tell you is that initially you see this is how it is, right? So here you have got the heart. Now if the heart is little bit more enlarged, what is going to happen? What is going to happen is that it will push the serous pericardium inside. If the heart is going to little bit more enlarged, right, like this completely, then what it is going to do, it will push the serous pericardium much more inside. And now, isn't it looking like a double layered? So can I tell serous pericardium is looking right now like a double layered pericardium? So what happens when your heart is completely distended or completely enlarged is, this is how your heart looks. Let us say that this is your heart which is completely enlarged with a vessel that is going outside like this. Okay, now surrounding your heart you already have this particular layer, right? So heart has completely pushed this layer and it is looking like a double layer now. I hope you are understanding whatever I'm drawing. Fibrous pericardium is also located like this. This is your fibrous pericardium. Okay, and this was the thing which I was drawing with the green over here. You see, this is the thing which I was drawing with the green like this. Okay, so here I hope you understood what are the different. Now look at these two pictures very clearly. Okay, so you see fibrous pericardium, this is the same fibrous pericardium. Serous pericardium, see these two layers together you call it as serous pericardium. But within these two layers of serous pericardium, you have got two more layers. What are those two more layers? See, this one over here is called as the outer layer. This is called as the outer layer, and this one over here is called as your inner layer. So outer layer and inner layer. So what do you call this outer layer and what do you call this inner layer as? Outer layer is called as parietal layer or parietal pericardium. Inner layer is called as serous pericardium. Parietal pericardium and serous pericardium. So you have got both parietal pericardium as well as your serous pericardium. So now you tell me what is pericardium. So overall I have to write this thing that pericardium is divided into two layers. What are those two layers? You have got an outer layer, you have got an inner layer. So outer layer is called as fibrous pericardium. Outer layer is called fibrous pericardium and inner layer is called as serous pericardium. Serous pericardium. Serous pericardium is again divided into two layers. Outer layer is called as your parietal layer. Inner layer is called as your visceral layer. Right, between the parietal layer and visceral layer you have got a cavity called as this pericardial cavity. So this cavity over here is called as your pericardial cavity. So this is one of the very important thing I want you to know. Now let us write down the differences. Okay, what are the differences? I will write down the difference between parietal pericardium as well as visceral pericardium. What are the differences between parietal pericardium and visceral pericardium? Parietal pericardium and visceral pericardium. So what are the differences between parietal and visceral pericardium? First important thing, parietal, if you look at the parietal pericardium, right, where is parietal pericardium? See this particular line, okay, let me use the red. See this particular line is called parietal pericardium. So can I tell that parietal pericardium is attached to what is this? This is called as fibrous pericardium. So it is adherent to what? Fibrous pericardium. And look at this visceral pericardium. Visceral pericardium is attaching to what? Heart. Okay, so what should I write over here? Parietal pericardium adheres to fibrous pericardium. Parietal pericardium adheres to fibrous pericardium, and visceral pericardium is adherent to myocardium. Adherent to myocardium of the heart. Second important thing, from where this parietal pericardium is developed? It is developed from somatopleuric mesoderm. It develops from somatopleuric mesoderm. Now from where does this visceral pericardium develop? It develops from splanchnopluric mesoderm. It develops from splanchnopluric mesoderm. It develops from splanchnopluric mesoderm. Third important thing is that what is this parietal pericardium layer innervated by? It is innervated by somatic nerves. It is innervated by somatic nerves, whereas the visceral layer is innervated by what? Autonomic nerves. Okay, so it is innervated by autonomic nerves. Okay, and the fourth very important point over here is that parietal layer is sensitive to pain and visceral layer is insensitive to pain. So this is sensitive to pain, visceral layer is insensitive to pain. Visceral layer is insensitive to pain. So these are the four important differentiating points between the parietal layer pericardium and visceral layer of pericardium. Now another important thing is that we have to discuss two important sinuses that are present in the heart. These are very important. Okay, so two important sinuses we have to discuss right now. So one sinus is like this. This is called as horizontal, or you can call it as transverse sinus. Transverse sinus. Okay, and if you look at another sinus is in this way. This sinus is called as oblique sinus. Oblique sinus. So how many sinuses we have got? Two sinuses. One is called transverse sinus, another one is called as your oblique sinus. Now if you look at the picture, you will understand it clearly, right? So let us say that this is the heart. Okay, now here you have got the pericardium that is outside, that is called as fibrous pericardium, and after that you have got the parietal layer, the inner black. There are two blacks here, right? The inner black line, whatever I am drawing here, is called as what? That is called as your pericardial layer. I mean, that is called as your parietal pleura. I mean, the parietal layer of your pericardium, not pleura, I'm sorry. So this one over here is called as your parietal layer. Then where is a visceral layer? The insert, all this part, whatever which I am showing it to here, this entire white part. Okay, so instead of drawing this, let me highlight this part like this. You see this entire green color part which I am highlighting to you right now, this entire green color part, right? This is called as your visceral layer. So we have got two layers over here. One is called as a pericardial layer, and next we have got visceral layer like this. Okay, so this entire layer over here is called as your visceral layer. So one is parietal layer, and this particular layer over here is called as visceral layer. Visceral layer. Okay. Next important thing is that now you know, now you got an idea here that we have got aorta. See here, we have got arch of aorta like this. Clear? So this is a valve that is opening over here. This is your arch of aorta. Next, after that, we have got a trunk here. What is this? Pulmonary trunk, right? Dividing into right pulmonary artery, we have got the left pulmonary artery. Okay. So here we have got the pulmonary trunk over here. Next, we have got two veins over here. If you remember, here we have got superior vena cava, and down over here we have got inferior vena cava. So it means here we have got superior vena cava, down over here we have got inferior vena cava. Superior and inferior vena cava. Next, how many pulmonary veins we have got? We have got 4 pulmonary veins, right? So 2 pulmonary veins on the right side here and 2 pulmonary veins on the left side here. Okay. So if I have to write down the names of all of this, right? So this is your aorta. This is your pulmonary artery. I mean trunk, pulmonary trunk. This is your superior vena cava. This is your inferior vena cava. This is your pulmonary vein, here also pulmonary vein and pulmonary vein. Okay. Now you can see, you can actually appreciate a sinus, right? You can actually appreciate and next important thing is that let me draw the tissue, the connective tissue that is connecting both of this. Here also, right? So these sinuses which I am drawing right now, these structures which I am drawing right now is covered completely by a fibrous sheath like this. Right? Now look here very carefully. Now the important thing over here is that here you can see 2 important sinuses. I don't think so this picture is difficult, right? These structures you know already. We have got ascending aorta, right? So what is this? This is called as your ascending aorta. We have got pulmonary trunk, right? Instead I will write PT, pulmonary trunk. We have got superior vena cava, inferior vena cava, 2 pulmonary veins on the right, 2 pulmonary veins on the left. The same thing, you know this. Now here if you see, we see a sinus over here, right? So this sinus, can I call it as transverse sinus? In the same way, can you see a sinus over here? So can I call this sinus as oblique sinus? So how many sinuses you have got over here? This particular sinus is called as transverse sinus, and this particular sinus over here is called as oblique sinus. Okay, so we have got 2 sinuses over here. One is called as transverse sinus and oblique sinus. Why do we need transverse sinus? There is a very important clinical correlation with the transverse sinus. So actually, along this transverse sinus, you can put a finger, right? For example, let us say that this particular thing is your artery. I mean your aorta, ascending aorta, and this is your pulmonary trunk. So artery and pulmonary trunk are located close to each other like this, right? So when I tell sinus, behind this you can actually poke your finger behind your aorta and pulmonary trunk like this. You can poke your finger like this, okay, and what you can do is that you can put a ligature. You can put a ligature over here, ligature, or in simple language, let us say a loop, a wire or a thread, whatever it is. Okay, so let us say you can put a ligature like this and tie these parts, tie the aorta and tie the pulmonary trunk temporarily, and you can connect the tubes of what? Tubes of heart lung machine here, and do the surgery, right? So whenever you are doing cardiac surgeries, what you do is that you put a ligature over here, block these two, connect the tubes, artificial tubes, one act as an aorta, one act as a pulmonary trunk, and attach it to the heart lung machine. Okay, so I'll show it to you, you will understand here. Yeah, you see in this particular picture that this is a tube. You see, this is your aorta over here, this is your pulmonary trunk. So don't you see that this tube is passing behind both of them, and this tube has come here, and you see it is attached over here. If you look at the next picture over here, you will understand. You see, this is your pulmonary trunk over here, this is your aorta. Behind that I am putting my finger. I will put the finger and I will tie these two things, and then I will attach tubes to this. So this is called as transverse sinus, and this is the same picture which I have drawn over here. You see, Aorta, pulmonary trunk, right? This is aorta, this is pulmonary trunk. See these two pulmonary veins on the right and on the left. Here we have got superior vena cava and we have got inferior vena cava. You see a sinus over here, right? You see a sinus over here. This is called transverse sinus. You see a sinus over here. This is called as oblique sinus. Now, one very important clinical point I want to highlight over here is that there is a condition where let me show these. Yeah, there is a condition where there is infection of what? Serous pericardium. How many pericardiums we have got? Fibrous pericardium, serous pericardium. If there is an infection of serous pericardium, what will happen? There is fluid that is accumulated between the two layers. It means there is a fluid that is accumulated in the pericardial cavity. This accumulation of fluid within the pericardial cavity, you remember when I was discussing the lungs, this is visceral pleura, this is parietal pleura. Both the pleura are like this, right? At some places the pleura are distended like this. These distended regions are called recess. If within this recess there is excess amount of fluid that is accumulated, what will happen? These pleura will separate from each other. You call this condition as pleural effusion. In the same way, if there is excess amount of fluid that is accumulated in the pericardial cavity, you call this condition as what? Pericardial effusion. You call this condition as pericardial effusion. So first, what is pericarditis? Pericarditis is inflammation of serous pericardium. Let me write these things down. So we are discussing right now about pericarditis. Okay, what is pericarditis? Pericarditis is nothing but inflammation of serous pericardium. Inflammation of serous pericardium is called as pericarditis. Now, whenever there is inflammation of serous pericardium, what is happening? There is accumulation of fluid. Where? Accumulation of fluid in the pericardial cavity. Accumulation of fluid in the pericardial cavity. Because of this accumulation of fluid in the pericardial cavity, you will have a condition called pericardial effusion. Pericardial effusion. Okay. What is happening in pericardial effusion? There is excess amount of fluid that is accumulated in pericardial cavity. Now, what I am telling you is that if within this pericardial cavity, if excess amount of fluid is accumulated, you call it as pericardial effusion. If fluid accumulation is too much, right? Too much, then the next stage or then the next condition that is developed over here is cardiac tamponade. So let me explain all these things right now to you, right? So all of you just look here. Let us say this is the heart. This is the heart. Okay. Now I am drawing attached to the heart. This is called as visceral pericardium. What is this? Visceral pericardium. Okay. After the visceral pericardium, the next layer which you have over here, what is this? This is called as parietal pericardium. Parietal pericardium. Visceral and parietal pericardium. Normally we have got around 50 ml of pericardial fluid here. Okay, so there is pericardial fluid in the pericardial cavity. Clear? And you should also remember one very important thing, that coming out of your left ventricle, the branch that is coming out of your left ventricle over here, branch that is coming out of your left ventricle over here is your aorta. This is your aorta. Next important thing, you should also know that the branch that is attached to here, we have got is a superior vena cava. Okay, superior vena cava. Now what is happening? What is happening is that if there is excess fluid here, you call this condition as pericardial effusion. Pericardial effusion. Now what I am telling you is that if the patient of pericardial effusion is not treated, then what will happen? The fluid accumulates still much. Yes or no? The fluid accumulates more and more. So when the fluid accumulation is very much, right, then what is going to happen over here? What is going to happen over here is that, you see, the fluid accumulation has happened excess now. Very, very, very excess. So when there is excess amount of fluid like this, don't you think this excess amount of fluid right now will compress the heart from all directions? Yes or no? So when it will compress the heart, it means it is squeezing the heart from all directions. When it is squeezing the heart from all directions, look at the left ventricle. Normally your left ventricle chamber is like this. Okay, and let me also draw this thing right now, that let us say this is the wall of your left ventricle. You see, this is all the muscle of your left ventricle. Now when your all chambers are squeezed, don't you think this is how the picture looks? If this is your left ventricle over here, when all your muscles when all your chambers are squeezed, don't you think this is how it happens? If it is squeezed from all the directions, see, previously there was this much amount of blood. This is the end diastolic volume. The amount of blood at the end of the diastole, the amount of blood that is present is called end diastolic volume. This is the amount of blood which we have. But now the amount of blood is too low. Why it is too low? Because from both the sides, the heart is squeezed. The heart is squeezed like this. So when it is squeezed, now tell me, here the amount of blood going out will be more, or in case B, case A, case B, in which case the amount of blood that is going out, it means the cardiac output will be high. It will be high in A, it will be low in B. So it means that there is less amount of blood that is going out into the aorta. When there is less amount of blood that is pumping out into the aorta, can I tell the first important clinical manifestation the patient will have is hypotension? Hypotension. Second important thing, when your all your atria, ventricles, all of them are squeezed, right? Let us say this is your right atrium. Attached to right atrium, you got the jugular vein and finally the superior vena cava. Let us say this is the neck vein over here. So now tell me, there is normal amount of blood over here. Now when this is compressed from all the directions, don't you think the blood will rush back into the veins? So when the blood will rush back into the veins, don't you think these veins will be dilated like this? Don't you see a dilated neck veins over here? So the second important thing what you see is distended neck veins. You see distended neck veins. Third important thing what you see is, when all such fluid is accumulated surrounding the heart, right, surrounding the heart, when you put a stethoscope, will you be able to listen to the heart sounds properly? No, there is a large amount of fluid barrier, right? Previously it was like this. You are putting stethoscope on this side and here you can listen to the heart sounds. Now here there is excess amount of fluid. Now you are putting a stethoscope here. Now the sounds are coming from here. Do you think the sounds will propagate all the way through the fluid like this and reach the stethoscope? No. So you will listen to heart sound, but muffled heart sounds. Okay, muffled heart sounds. So these conditions together, you call it as cardiac tamponade. And you see these three important things, this is called as a triad, and this triad is called as Beck's triad. What is this triad called as? Beck's triad. Okay, so what is the only treatment I can do in this condition? The only treatment which I can do in this condition to this patient is remove the fluid. When you remove the fluid, the pressures will be reduced. So that condition you call it, that procedure you call it as pericardiocentesis. You call it as what? Pericardiocentesis. So how do you do the pericardiocentesis? Is that you look at the sternum. Now you know where is the 5th and 6th intercostal space. So just sight to the sternum in the 5th, 6th intercostal space, mid clavicular line. What you do is you put a needle and drain the fluid outside. So how do you do the pericardiocentesis? There are two approaches over here. In one approach what you do is that 5th or 6th intercostal space, right, adjacent to sternum. What do? You put a needle and drain the fluid out. Next, another important way is you look at the xiphoid process, and if this is a xiphoid process over here, Put the needle 45 degrees upward and puncture inside the xiphoid process over here. Sub-xiphoid, just beneath your xiphoid process, put the needle 45 degrees and then move upward. Okay, so that is called as sub-xiphoid approach. That is called sub-xiphoid approach, where you put a needle at how many degrees? 45 degrees. 45 degrees you pass the needle in the upward direction. 45 degrees you pass the needle in the upward direction. So two important things to keep in mind. One is this approach, pericardiocentesis is done by one approach, and the other one is your sub-xiphoid approach over here, right? So these are the two ways how you reduce the what you call the pressures over here. So you can see in this particular picture over here that the neck veins are distended over here. So there is increased JVP, jugular venous pressure. Actually what neck vein is that? That is a jugular vein. Okay, so there is increased pressure within the jugular vein, so you call it as increased JVP. Okay, increased jugular venous pressure. So now we shall be discussing regarding the structure of the heart and the chambers of the heart. Okay, so first important thing you need to know is that the weight of the heart, in the males the weight of the heart is around 300 grams and in females it is 250 grams. Okay, the weight of the heart in males, it is around 300 grams in males, and it is around 250 grams in case of females. Okay, next important thing is that we have to know what are the two important landmarks here, right? So we have got two important structures over here. This is called as your apex of the heart. Okay, so as you can see this differentiation over here, so this entire thing is called apex of the heart. This is called as the base of the heart. Base of the heart better you can visualize from the posterior side. Here you cannot visualize the base of the heart. Why? Because here you have got, what is this? This is your pulmonary artery and pulmonary trunk, right? In the same way you have got this particular, what is this? This is your aorta. So your pulmonary artery, pulmonary trunk and aorta, all of them are overlapping here. That is why you cannot see the base of the heart. So base of the heart is best visualized from the posterior side. Now if you look at the borders of the heart, what are the border do we have? So here we have got this particular border called as a superior border. Okay, and this particular border over here is called as your right border of the heart. Okay, and this particular border over here is called as the left border of the heart. And finally this particular border over here is called as the inferior border of the heart. So how many borders we have got? 4 borders of the heart. So superior border, right border, left border and inferior border. And as I was telling you, apex of the heart is downward, is basically mediated downward, right? So it is downward to the left side. Okay, so that is where the apex of the heart is directed towards. So topographically speaking, where is the apex of heart present? Topographically speaking, apex of the heart is present in the 5th intercostal space. So here you will have 1 2 3 4 5 5th intercostal space. So if this is a mid clavicular line over here, medial to mid clavicular line, in the 5th intercostal space you have got the apex of the heart. So where is the apex of the heart located? In the 5th intercostal space, medial to mid clavicular line. Okay, mid clavicular line. But whereas in infants, if this is the adult, this is the adult heart which I have told you. But whereas in infants the apex of the heart is present in the 3rd or the 4th intercostal space. After 1 to 2 years, the infant will achieve the adult heart. Okay, adult heart in the sense the position of the adult heart, that is 5th intercostal space. So in the infants it is around 3rd or 4th intercostal space. Now after that we basically should start our discussion with the base of the heart. Base of the heart. Always and always remember, I will draw the picture right now. Okay, so I will draw the picture, but before that you just need to know the other name for the base of the heart is a posterior surface of the heart. So anyways I will draw the base as well as the anterior surface, both of them, but for now I am telling you, later on I will remind you this thing, that base of the heart is formed by right atrium plus left atrium. Okay, both right and left atrium together form your base of the heart. Clear? So the base of the heart is basically formed by the right atrium as well as left atrium. So if you look here, 1/3, not the complete right atrium, only 1/3 of the right atrium as well as 2/3 of the left atrium takes part in the formation of the base of the heart. Okay. Now, if I ask you where is the base of the heart located, I mean, so topographically speaking, where is this base of the heart? First of all, this base of the heart, if you look right in relation with the vertebra, it is present at the level of T5 to T8 vertebra. It is present at the level of T5 to T8 vertebra. When you see this position, you see this position in the lying down, I mean in the supine position, in the lying position. In the lying position, if you look at the base of the heart is present at the topographic level of T5 to T8. But when you are standing, right, when you are in the erect position, the base of the heart will just move one vertebra forward, which means T6 to T9 vertebral level. Okay. Now first what we'll see is that we shall just draw the gross picture of the anterior view and the posterior view, and we shall see all the chambers over here. Later on we'll discuss in detail about each and every structure and chamber which is present over here. Okay. So let us say that this entirely is your heart like this. I'm just drawing the rough picture over here. Okay. Now this part which is in the form of a leaf is called as a right auricle. What is this? This is called as right auricle. In the same way, you see a structure in the form of a leaf on the left side. This is called as left auricle. One is called as right auricle, another one is called as left auricle. So this top one over here is called a right auricle. The lower one over here is called as right atrium. What is this? A leaf shaped structure on the top is called a right auricle, and down over here you call it as a right atrium. Okay. And let me draw one more line over here so that you would understand this completely. So this is one line over here, and let me also draw one more line over here. Right. Now here, what are the important things you have to know? First important thing is, as I already told you, the upper part is called as right auricle and lower part is called as your right atrium. So let me differentiate this part over here. So till here, upper part is called right auricle, lower part is called right atrium. Next important thing is that here you have got this particular part is called as your left auricle, and down over here this structure is called as your left ventricle. Left auricle and left ventricle. Okay, left auricle and left ventricle. Okay. So this is your left auricle, down is your left ventricle. And next, down over here, whatever you can see right now is called as your right ventricle. What is this? This particular structure over here is called as your right ventricle. So this entirely is your right ventricle. And one very important thing you need to know, that from the right ventricle, the artery which is coming out is called as your pulmonary trunk. Okay. So you know that the pulmonary trunk is divided into two branches. I mean divided into right pulmonary artery and the left pulmonary artery. After that, you also know that here you have got what is this? This is called as your aorta. What aorta is this? This is called as your arch of the aorta. And you also know one very important thing, this arch of aorta gives out three branches. What are those three branches? See, one branch is called as your brachiocephalic trunk. This is your brachiocephalic trunk. Next here you got is the common carotid artery, and here you've got is the left subclavian artery. Brachiocephalic trunk, left common carotid and left subclavian. Next important thing is that from the top over here, you have got a vein that is entering into your right atrium. This is called superior vena cava. Exactly down here you will have another vena cava that is called as your inferior vena cava. So how many vena cavas you have got? One is called as superior vena cava, down you have got the inferior vena cava. So let me write down the names over here. So this part over here is called as right auricle. An ear shaped or a leaf shaped structure is called right auricle. And this one over here is called as your right atrium. Okay. Yeah. So this one over here is called as your right atrium. Okay. In the same way, this one over here is your left auricle, and down here you call it as a left ventricle. If this is left ventricle, this is your right ventricle. Okay. So this picture which you can see over here, this is your anterior view. What view is this? This is your anterior view. Now if you look at the posterior view, how does the heart look on the posterior view? So basically this part over here is called as the apex of the heart. Clear? This part over here is called as your apex of the heart. Next, after drawing the apex of the heart, next important thing is that posteriorly you can see a ventricle called as a atria called as left atrium. Okay, but before that let me finish up the picture completely. So here you have got one pulmonary vein, here you have got another pulmonary vein. These two are called as a left pulmonary veins. And here you have got a pulmonary vein on the right. These two are called as a right pulmonary veins. So what are these? These are called as your left and right pulmonary veins. Okay. And next important thing is that I told you on the top, what do you have? This is called as your superior vena cava. This is your inferior vena cava. Okay, so on the top over here you have got your superior vena cava like this. Okay, and remember that this is one chamber of the heart. Okay, and next important thing, down here you have got your inferior vena cava. Okay, so I think this is, yeah, so this is your inferior vena cava. Okay, so this is your heart over here. Now what I'm telling you is that there is a line that is separating two atria and ventricles over here. This is called as atrioventricular groove. Okay, in the same way separating two ventricles also over here. So basically this picture which I have drawn over here is a posterior surface. Okay, and remember that here also you have got a leaf shaped structure. Now listen carefully. See here, this is your left auricle. Once if I turn the heart, this left auricle continues like this. Clear all of you? So again, this is also your left auricle. What is this? This is also called as your left auricle. Then where is your left atrium present? See, this particular part is called as your left atrium. Now into the left atrium, how many pulmonary veins are opening? 4 pulmonary veins. 2 are called as left pulmonary veins, 2 are called as right pulmonary veins. So it means these 2 are called as left pulmonary veins because they are to the left side. These 2 are called as a right pulmonary veins because they are to the right side. Next, where is the another atrium that is located? What is another atrium over here? That is your right atrium. So this part over here is called as your right atrium. Okay, so this part over here is called as your right atrium. And by the way, not to forget, so when I tell left atrium, so this entire part, okay, this entire part over here is your left atrium. Now when it comes to left ventricle and right ventricle, see this part over here is called as your left ventricle. Okay, and this part over here is called as your right ventricle. Okay, so this part over here is called as your left ventricle and this is your right ventricle. And what is this? This is your right atrium. Sorry, this is your left atrium. Left atrium and this is your right atrium. Right atrium. So this is the heart which you look from the anterior and from the posterior view. Okay, so these are the structures that are present over here. Now additionally, to make it look like a heart, what we have to do is that we just have to draw the pulmonary arteries here, right and left pulmonary artery, and you know from the back the artery that is coming over here, this is your aorta like this, right? Whatever, just rough picture I have drawn over here. Okay, now another important thing over here is that, okay, first of all let us revise the things which you have written over here. So this is anterior and the other side is the posterior. So anteriorly what structures are visible? You can say right auricle, right atrium, left auricle, left ventricle, and right ventricle. Can you see right atrium? No, right atrium is better completely visualized from the posterior side. Okay, right atrium is best visualized from the posterior side. In the same way, left auricle is best visualized from the posterior side only. So if I ask you base of the heart, where did I tell you base of the heart previously? Base of the heart is nothing but the posterior surface. It means this one. So this part is the base of the heart and this part is the apex of the heart. Now tell me, in the base of the heart majorly two structures are present. What is that? Left atrium and right atrium. This is what we have written, left atrium and right atrium. Left atrium is 2/3, right atrium is just 1/3. You see, left atrium is a larger portion compared to the right atrium. Okay, so this is the important thing. Coming to the surfaces. Coming to the surfaces of the heart. what are the different kinds of surface which you have? We basically have got three important surfaces. The first important surface is called as sternocostal surface. What is the first important surface? Sternocostal surface, or you can call it as an anterior surface, right? For example, if this is the heart, this is the heart which I have, you know, in front of the heart there is sternum, side to the sternum there is ribs. So what is this surface of the heart? That is your what are these? Ribs. Sternocostal surface. Coast are the ribs. Sternocostal surface. Okay. Now when I tell you sternocostal surface, within this sternocostal surface, first of all, sternocostal surface is formed by what? Now you tell me, what is this? See, this entire thing which you can see over here is a sternocostal surface. It is formed by, can I tell, it is formed by right auricle, it is formed by right atrium, yes or no? It is formed by right ventricle, majority. It is formed by left auricle as well as left ventricle. It means all the structures that are located in the anterior surface of the heart, all of them together will form your, what? Will form your sternocostal surface or anterior surface. So these surfaces are formed by what? These surfaces are formed by left auricle. So here we have got what? We have got a right auricle, right? So we have got a right auricle, right? We have got right auricle over here, right atrium. Right atrium. Next we have got left auricle. After that we have got the right ventricle and the left ventricle. So these are the five important structures. Second, what is the second important thing is that diaphragmatic surface. What is the surface? Diaphragmatic surface. Diaphragmatic, or also called as a posterior surface of the heart. What do you mean by this? What do you mean by this is that, see, this entire bottom part of the heart is called as a diaphragmatic surface. Now looking at this, you will think that inferior surface is diaphragmatic surface. No, from posteriorly you can see the diaphragmatic surface. You see the right ventricle and the left ventricle, both of them over here. So these two structures, right? So let us say that this is the anterior surface. Okay, this is the anterior surface and this is a posterior surface. Now in this posterior surface, let us say here there is left atrium, and here there is right atrium. Okay, so on the back you see in the picture here, left atrium, right atrium. Below that, what do you have? You have got right ventricle, you have got left ventricle. But I am holding the paper like this, which means you can say left atrium right away, right? Because it is exactly in front. But lower surface, what is the lower surface having? Right ventricle and left ventricle. Can I tell these two are lying on the diaphragm? This is a diaphragm. They both are resting on the diaphragm like this, right? So in this picture you can't see that thing. Okay, but in the reality you can see that both left ventricle and right ventricle, they rest on the diaphragm. Okay, so that is why diaphragmatic surface of the posterior surface, where the right ventricle and the left ventricle posteriorly, right ventricle and left ventricle posteriorly, they rest on the diaphragm. They rest on the diaphragm. So that is why you call it as the diaphragmatic surface. Next, third important surface is called as a left surface. Okay, what do you mean by left surface over here? All the structures that are present on the left. For example, on the left side, in the sense this is your left side. On the left side, what do you have? You have got left auricle, right? You have got left ventricle, yes or no? And attached to the left auricle on the back here, you have got the left atrium, right? So all the structures that are on the left, what are the left structures over here? Left in the sense left auricle, left atrium, left auricle, left atrium and left ventricle. Left auricle, left atrium and left ventricle, all these structures form the left surface. So if I ask you how many surfaces of the heart you have got, three important surfaces you have got. One is called as a sternocostal or the anterior surface. Next one you have got is a diaphragmatic or the posterior surface. Third one you have got is a left surface. Right? Now when it comes to sternocostal or anterior surface, these are the structures which we have. Diaphragmatic or the posterior surface, these are the structures, and left structures are these. Okay, these are the structures which you have over here. Now coming to the borders of the heart, how many borders of the heart you have got, which we already discussed, right? You see, border of the heart. So this border of the heart is called as the right border of the heart. This border of the heart is called as the left border of the heart. This is called as the inferior border of the heart, and this is called as the superior border of the heart. Okay, what did I tell you in the starting? Superior border of the heart you can better visualize from the back, because in the front you have got the pulmonary trunk arteries and the aorta. All of these are overlapping. You cannot see the border. So if I ask you, the right border of the heart is formed by what? Can I tell this entire right border is formed by right atrium? Yes. Can I tell that the left border of the heart is formed by the left auricle and the left ventricle? Yes or no? See, this is the left border of the heart formed by left auricle and the left ventricle, not atria, left auricle and the left ventricle. If I ask inferior border of the heart, now inferior border of the heart, you first have to know inferior border of the heart extends from, all the way it extends from inferior vena cava till the apex of the heart. This is your apex of the heart. So this border is called as the inferior border of the heart. Okay, so inferior border of the heart is majority, it is formed by what? Right ventricle and a little part of left ventricle. When I ask superior border of the heart is formed by what? See, this is a superior border. Superior border is formed by right atrium and left atrium. Both of them form the superior border of the heart. Okay, so these are the borders of the heart. Once again, let us discuss. The right border of the heart is formed by right atrium. Left border of the heart is formed by left auricle, left ventricle. Inferior border of the heart is extending all the way. If this is your apex, inferior border of the heart extends all the way from inferior vena cava till the apex of the heart, formed by right ventricle and left ventricle. Superior border of the heart, here you cannot see. This is a superior border of the heart. Here you cannot see. Why? Because there are pulmonary artery, trunk and systemic aorta. So the same place on the back. What is the superior border of the heart? Formed by left atrium and right atrium. Okay, so let us write down all the structures over here. Okay, so what are the borders of the heart? What are the borders of the heart? First important thing is right border. Okay, right border of the heart is formed by what? Right border of the heart is formed by right auricle or right atrium. It is your right atrium. Okay, next we have got the left border of the heart. Left border of the heart is formed by left auricle and left ventricle. Left auricle and left ventricle. Third important thing is the inferior border of the heart. Okay, inferior border of the heart is formed. Inferior border, first of all, it ranges all the way from your inferior vena cava till the apex. Okay, so inferior border of the heart is formed by what? What is the structure that is formed the inferior border of the heart? It is formed by both right ventricle plus left ventricle. Majority is the right ventricle, little is the left ventricle. Fourth important thing, superior border of the heart. Where can you see the superior border? Superior border is best visualized from the posterior aspect. Okay, from the posterior aspect. Now, superior border is formed by both right atrium plus left atrium. Okay, right atrium plus left atrium. Okay, now after this we shall discuss some more important things called as groove or sulci. Okay, so let us discuss these important things now. Groove or sulci. So let us say this is the heart. I'm just drawing a rough picture of the heart here, just to identify the grooves or sulci. Now whatever structures I have drawn over here, these are the structures that are present outside, not inside. Okay, these are the structures that are present outside. Now you see that there is a line that is present over here. You see this line? Where is this? How is this line separating? This line is separating both the atria from the ventricles. And by the way, I should write here, this is right atrium, left atrium, right ventricle and left ventricle. So this line is separating both the right atria, left atria from the right ventricle and left ventricle. This is called as atrioventricular groove. What is this called? This is called atrioventricular groove. Now out of this atrioventricular groove, there are two types. I mean there are two halves. So this half over here, right, this half over here is called as right atrioventricular groove, and this half over here is called left atrioventricular groove. So this is called as a left atrioventricular groove, and this one over here is called as right atrioventricular groove. So we have got two important things, left atrioventricular groove, right atrioventricular groove. Okay, now this left and right atrioventricular groove, what are the structures that are present here? For example, within this left atrioventricular groove, you have got an artery called as left circumflex artery, LCA. Left coronary artery. What is this? You have got left coronary artery, and a branch of left coronary artery is called circumflex branch. We will discuss about it later. Circumflex branch. Okay, these are the structures that are located in the, what is this, left atrioventricular groove on the anterior side. Okay, on the anterior side. Next, you have got a vein called as greater cardiac vein. Greater cardiac vein. Greater cardiac vein. Okay. Now let us go to the right atrioventricular groove. In the right atrioventricular groove, what do you have? Here also you have got two structures. Here there is left coronary artery, then here there will be right coronary artery. Here there is greater cardiac vein, here there will be lesser cardiac vein. Lesser cardiac vein. So these are the structures that are located in the atrioventricular groove. Now on the back side also you will have atrioventricular groove. That is called as a posterior atrioventricular groove. Posterior atrioventricular groove is having a sulcus called coronary sulcus. So posterior atrioventricular groove is having a sulcus called as coronary sulcus. What is that? It is having coronary sulcus, right? Coronary sulcus. Next important thing, let us discuss about the structures that are present between the right ventricle as well as the left ventricle. Now you see this particular structure in the center. This is called as a groove that is separating both the ventricles. So what do you call it as? Interventricular groove. This is present on the front, it is present on the back also, right? So what is this structure called as? This structure is called as interventricular groove. Interventricular groove. How many interventricular grooves we have got? Two. Okay, one on the anterior side and one on the posterior side. So we have got two important grooves, one groove on the anterior side, one groove on the posterior side. Now what is the structure that is present in the anterior side? The first important structure is anterior interventricular groove has got interventricular artery. Anterior interventricular artery, you also call it as left anterior descending artery. I will tell you about this later on. Okay, just remember it as LAD. Second important thing, it is also having a vein called as greater cardiac vein. Greater cardiac vein. Okay, in the same way, if you look at posterior interventricular groove, what is the artery that is present over here? That is your posterior interventricular artery. And what is the vein that is present? Not lesser cardiac vein, it is middle cardiac vein. It is middle cardiac vein. So it is middle cardiac vein. Okay, so we have discussed almost all the important structures over here. So what are the structures we have discussed? That right atrium, left atrium, and right ventricle, left ventricle, both the atria and ventricle are separated by atrioventricular groove. So this atrioventricular groove is present on the right side, left side. Right half is having right coronary artery and it lodges right coronary artery and the lesser cardiac vein. The left atrioventricular groove will lodge left coronary artery and greater cardiac vein, and so on, so follows over here. These are the important structures over here. Okay. So now what we shall do is that after discussing this, we shall discuss about each and every chamber of the heart. Okay. So a topic of discussion would be regarding the chambers of the heart. Now regarding these chambers of the heart, what are the different chambers you have got? Now before we discuss the chambers, you have to know one basic thing. The basic thing is that basic thing is that if you see the heart inside, the internal structure of the heart, this particular septum over here is called as interatrial septum. What is this? Interatrial septum. And down here the septum is called as interventricular septum. Interatrial septum and interventricular septum. And you should also know one very important thing, that on the right side also there is an opening, on the left side also there is an opening. So let me write this: right atrium, this is left atrium, this is right ventricle, this is left ventricle. Okay. Now the valve that is present over here on the right side is called as tricuspid valve, which means there are three cusps. There are three valves, three cusps. Okay. Here we have got two cusps over here. This is called as bicuspid valve. So what are the two valves over here? Tricuspid valve and bicuspid. Tricuspid, why? Because there are three cusps. Bicuspid, why? There are two cusps. Okay. So if you look at this particular picture, you already know one very important thing. What is that? This particular structure over here is called as your right what? Auricle. And this is called as your right atrium. Right auricle and right atrium. Now you know, if I have to enter from right atrium into right ventricle, I have to cross what? Tricuspid valve. It means if this is right atrium, this is right ventricle, if I have to cross like this, it means somewhere here there should be a valve, and that valve is called as what? Tricuspid valve. Okay, that is your tricuspid valve. So let me draw the tricuspid valve over here. See, this particular valve over here is called as your tricuspid valve. You see? See, this particular valve over here is called as your tricuspid valve. Okay. Now this particular tricuspid valve, if you see here, let me draw the tricuspid valve over here. Okay. If this particular tricuspid valve has got two more valves, this is called as an anterior valve. Okay. And this is called as a posterior valve. So what are the two other valves over here? This is called as an anterior valve of the tricuspid valve. This is called as a posterior valve. It has got two more walls. I'm not talking about valves, I'm talking about walls. There are two walls of a tricuspid valve. What is that? Of a tricuspid valve, there are two walls, anterior wall and posterior wall. So to this anterior and posterior wall, there are some structures that are present. What are these structures? Let us say the first important thing is, see here, okay, let me use a pink. So here the cusp, whatever I'm drawing over here, this is called as a anterior cusp. Okay. After that, the cusp, whatever I'm drawing over here, is called as a posterior cusp. Okay. Next, the cusp which I'm drawing with the green, which is not visible over here, but try to understand this, that the cusp which I'm drawing with the green on the posterior side is called as what? This is called as septal cusp. Okay. So what are the three important cusps you have got over here? This cusp over here is called as anterior cusp. This is called as your posterior cusp, and this is called as your septal cusp. Okay. So all these three cusps together, you call it as, what do you call it as? Tricuspid valve. This you call it as tricuspid valve. Okay. This is your tricuspid valve. Now if you wanted to look at this complete right atrium, what will I do? And by the way, remember one thing, that you see this outermost border of right atrium, you see this outermost border of right atrium is having a sulcus called as, what is this sulcus called as? This is called as, what is this called as? This is called, repeat, this sulcus is called as sulcus terminalis. What is this? Sulcus terminalis. What is sulcus terminalis? This is the sulcus that is present in the outer border of right atrium. So outer border of right atrium is having a sulcus, and this sulcus is called as sulcus terminalis. Okay, that sulcus is called as sulcus terminalis. Clear? Now what I'm trying to explain you over here is that let us say that this is your right atrium. Okay, this right atrium is having a sulcus. You see, this sulcus is called sulcus terminalis. Where it is present in the center? No, it is present outside. Outside you have got sulcus terminalis. Now if I am cutting the right atrium like this, if I am cutting the right atrium and I am opening the right atrium to you. So when I am opening this right atrium, you see once I opened this, how many surfaces came? 2 surfaces. So right atrium is having 2 surfaces. What did I do? I have just opened it in the form of a flap. After opening the right atrium, I can see 2 surfaces, and in between also I can see a sulcus, right? So the same sulcus outside you called it as sulcus terminalis. Now what I am telling you is that this sulcus inside, after cutting open right atrium, this sulcus you called as crista terminalis. What do you call crista terminalis? Okay, so this entirely is your right atrium. You have cut open into 2. Outside this is called sulcus terminalis, inside this line is called crista terminalis. So after cut opening right atrium, the sulcus which you have is called as crista, what do you call? Crista terminalis, crista terminalis. Okay, right. Now first we will discuss about the right atrium. So once I've cut open this, this is how it looks. You see, this was the flap. This was the flap before. This flap was on this. I've just opened this flap outside. Right, so when I've cut open, see I've cut the right atrium here and I've once opened it out. Once they have opened it out, this is the flap here. So this line in the center, what should I call it now? Crista terminalis, right? So this line in the center is called crista terminalis. So right now we are discussing about the right atrium. Right atrium. Okay, this is your crista terminalis over here. Now very important thing is that how many surfaces, how will you discuss this right atrium? Right atrium I will discuss in 3 walls. What are those 3 walls? We have got a smooth part. Right atrium is having a smooth part. Right atrium is having a rough part. If you remember the development of the heart, there itself I have talked. You have got the rough part. Where is the smooth part located? Smooth part is a posterior part. Where is the rough part? Rough part is the anterior part. Okay, it means this is the anterior part, this is the posterior part. Here it is rough, here it is rough, here it is smooth. Okay, so what do you call smooth part of right atrium? Also called as sinus venerum. You remember that? I have discussed it already in the development of heart, sinus venerum. Okay, rough part is also called as atrium proper. What do you call it as? Atrium proper. And lastly you have got the septal wall. Lastly, you have got what? Septal wall. Now, here, if you look at this particular atrioventricular septa or tricuspid valve, what is this part called as? What is this part? This is called as your septal cusp, right? So, if I am opening this, you see this part over here, this is called as your septal cusp. Okay, so this part over here is called as septal cusp. I am not writing it, just remember. Okay, let me mention it down over here. So, this part over here is called as your septal cusp. Just remember it. Okay, it is your septal cusp. Now this I will show all these 3 parts, but for now what you need to know is that what is this smooth part or sinus venerum consisting of? This smooth part or sinus venerum is having 3 openings. Okay, it is having 3 openings. What are the 3 openings? Look here. The first opening is this. First opening is this superior vena cava opening right away into the right atrium. Okay, so superior vena cava is one opening. Next, down here you have got inferior vena cava, the second opening. Third opening is called as coronary sinus. What is the third opening called? Coronary sinus. Coronary sinus is here. Okay, so anyways, I will draw these things in a minute. Okay, in detail I will explain you, but for now, what are the 3 openings over here? One opening is superior vena cava, inferior vena cava, this is coronary sinus. 3 openings. One is superior vena cava opening, inferior vena cava, and coronary sinus. What is the use of this coronary sinus? Use of this coronary sinus is that around 60% of the heart, the venous blood of the heart, it will drain into this coronary sinus. How much? 60% of the venous blood of the heart drains into this coronary sinus. Now this is the overall picture which I have drawn. Now let us discuss in a bit detailed. Okay, let us discuss in a bit detail about what are all the structures we have got. So what we'll do is that we shall just duplicate this picture and let us put it down and discuss all the structures over here. Okay, so let me rub away few structures like this one. Right, so let me redraw this. So here you know that here we have got, what is this? This is called as your superior vena cava, and down here we have got your inferior vena cava. Okay, inferior vena cava. Now after, okay, let me write it down, superior vena cava and inferior vena cava. Now the first important thing I'm telling you is that if you look at inferior vena cava, okay, if you look at inferior vena cava like this, so this is your IVC, inferior vena cava. Now this inferior vena cava is having two walls. What are the two walls? See, this wall of inferior vena cava is called anterior wall, and this this wall of inferior vena cava is called as posterior wall. So what are these two walls? This wall is called as anterior wall. This wall is called as posterior wall. Now attached to the anterior wall, okay, attached to the anterior wall, you see a green color valve here. Where is this green color valve? Attached to the anterior wall or posterior wall? Attached to the anterior wall. This particular green color valve is called as Eustachian valve. Okay, this valve is called as Eustachian valve. Okay, what is this valve called? Eustachian valve. Now if I put this Eustachian valve outside like this, you see this is your Eustachian valve which is attached to the anterior wall of inferior vena cava. This Eustachian valve is having two horns. This is called, there are two horns over here. So this horn over here is called as your left horn. Okay, and what is this called? This is called as the right horn. So one is called as the left horn, another one is called as the right horn. So all of you just pay attention over here. If this particular structure over here, this is the thing, right? And inside here, what is this? You have got this. This is called as your Eustachian valve. And here you have got one horn over here. What is this horn? This horn is called as a left horn, and this one over here is called as your right horn. Left horn as well as your right horn. Now from this left horn, what is happening? This particular left horn is in continuous with a limbus over here. Left horn is continuous with a limbus. This is called as what? Limbus fossa ovalis. What do you call this? You call this structure as limbus fossa ovalis. So let me write it down over here. This particular structure over here, you call it as limbus fossa ovalis. So what is this limbus fossa ovalis? The left horn is continuous with limbus fossa ovalis. Left horn is continuous with your limbus fossa ovalis. Okay, that is continuous with your limbus fossa ovalis. Now after that, what about the right horn? The right horn, what is happening is that it forms the inferior most part of the crista terminalis. What about the right horn? The right horn forms the lower end of the crista terminalis. Okay, so this entirely is your crista terminalis, entirely is your crista terminalis. So the lower part of the crista terminalis is continuous with the left horn. Okay, so it means this is how the left horn is continuous with the lower end of your crista terminalis like this. Okay, so what about the upper part of crista terminalis? This upper part of the crista terminalis forms nothing but called as your SA node. Okay, upper part of the crista terminalis upper part upper part forms your SA node. Upper part of crista terminalis forms your SA node, and lower part of crista terminalis isn't continuous with the right horn or the left horn, it is continuous with the right horn. Okay, I hope till here guys all of you are understanding whatever I'm trying to teach you, right? So this might be little bit tricky, difficult, but trust me, this is the easy thing. Okay, now next important thing is that, so here I have got a fossa. You see, one is limbus, that is called as a limbus, but this is called as your fossa. Okay, that is called as limbus, but this is called as fossa. What is this? This is called as your fossa ovalis, FO in the sense fossa ovalis. Fossa ovalis is bounded anteriorly. See, fossa ovalis is covered anteriorly by limbus, superiorly and posteriorly, right? But inferiorly there is no limbus, there is a deficiency. Okay, so surrounding there is a limbus covering your fossa ovalis. This is a thing which you need to know. So what are the openings I promised here? One superior vena cava opening I told you, inferior vena cava opening I told you. Now I am discussing about coronary sinus. See, where is your coronary sinus located? See, here देखो, this is your coronary sinus. This is a third opening called as coronary sinus. Okay, now this coronary sinus is also having a small valve here. If you can see here, coronary sinus is also having a small valve, and this valve over here is called as Thibetian valve. Okay, so first of all, what is this? This particular thing over here is your coronary sinus, and this coronary sinus is having a valve called as Thibetian valve. What is this? This is called as Thibetian valve. Okay, so where is coronary sinus present? Can I tell? Coronary sinus is present between opening of inferior vena cava and what is this? This is called as your septal cusp. It is present between inferior vena cava and septal cusp. So it is present between inferior vena cava and the septal cusp. Present between inferior vena cava as well as your septal cusp over here. Next, on the top here, exactly side to the superior vena cava, you have got a tubercle. Actually, this tubercle has got a very good importance over here. So this tubercle is called as intervenous tubercle of lower. What is this? Intervenous tubercle of lower. Intervenous tubercle of lower. What do this intervenous tubercle of lower do? This will direct the blood. Okay, this will direct the blood from superior vena cava to the right ventricle. So what is its function? It will direct the blood all the way from the superior vena cava to your right ventricle. Okay, so this is one very important thing you have to know. Next important thing is that here exactly you will see a small elevation. You see a small elevation on the septal region over here. What is this elevation called as? This is called as torus aorticus. What is this torus aorticus? This elevation is produced by ascending aorta. It is produced by ascending aorta. Ascending aorta produces this elevation called as torus aorticus. Next important thing is that just beneath this intravenous tubercle of lower, you will have very small minute foramens over here. Okay, so what are all these small minute foramens? These small minute foramens are called as foramina venerum minimarum. Okay, this is called foramina. Okay, this is called as foramina venerum minimarum. It means you can also call it as small foramens for the veins or small venous foramens. Okay, why do you call? Okay, let me put all these things down over here. Why do you call this as foramina venous minimarum? The reason why you call this as foramina venous minimarum is that within these there are small veins of the heart that are passing. Small veins of the heart. Veins are called venae. Heart is called cordis and small is called minimae. So venous cordis minimae, it means small veins of the heart. Small veins of the heart are passing through this. Actually, this foramina venerum minimum, this is present in all the chambers. Every chamber is having this, but mostly it is present on the right side, right chambers. It means right atrium and right ventricle. And very few foramens are present on the left atrium and left ventricle. By this, what you understood, that there is a very good rich blood supply on the right side, because more foramens, more vessels, right? Less or poor blood supply on the left side. That is the reason why myocardial infarctions are more common on the left side than on the right side, because left side the blood supply is poor. Okay, so this is one very important thing you have to understand over here. Right, next important thing, what is the next important thing is that above this coronary, this is your coronary sinus, right? So above this coronary sinus, you see I'm drawing a tendon over here, right? You see a tendon, this is called as tendon of Todaro. What is this tendon called as? This tendon is called as tendon of Todaro. Okay, what is this called? This is called tendon of Todaro. Now, one side there is tendon of Todaro on the top, bottom there is coronary sinus, right? On one side we have got the septal cusp. Okay, so tendon of Todaro on the top, down coronary sinus, on the right side you have got your septal cusp. All these three are lodging a triangle here, you see. If you see here clearly, all these three are lodging a triangle over here. This triangle over here is called as triangle of Koch. Okay, what is this particular triangle called as? This is called as triangle of Koch. What is this? Triangle of Koch. What is this triangle of Koch consisting of? AV node. Triangle of Koch is consisting of what? AV node. Now I hope you know the borders of triangle of Koch, right, which consists of what? AV node. Next, so whatever right now we have discussed is, we have discussed about the smooth part. Okay, now let us discuss about the rough part. Rough part is very easy, right? Why you call it as rough part? Because you have got muscles here. You see, you have got muscles here. In the rough part you have got muscles. These muscles over here are, what do you call these muscles as? Musculi pectinati. This is called as musculi pectinati. That is the reason why, because of this musculi pectinati, the surface here is rough. So you called as rough part. Septal wall is this one, which is consisting of fossa ovalis. Okay, fossa ovalis is the septum. It means if you look at this particular picture, here you have got the fossa ovalis, that is a septum, interatrial septum. Okay, having the fossa ovalis over here. So these are all the important things which you need to discuss regarding the right atrium. Out of all chambers, guys, the most important chamber, again I'm telling you, is the right atrium. Okay, so we will discuss mainly about the right atrium out of remaining all the four chambers. This is the main part which we shall be highlighting now. Okay, so right atrium is very, very important. Now we shall be discussing regarding your right ventricle. Okay, so regarding the right ventricle, so what are the important points you need to know regarding the right ventricle? So if you look here, this part is called as your right ventricle, all of you know. Right now this right ventricle is basically divided into two halves. Okay, you see this lower part. This is the lower part of the right ventricle. Basically the lower part of the right ventricle is rough. Okay, the lower surface of the right ventricle is rough and the upper part is smooth. So this is the lower part of the right ventricle. This is the upper part of the right ventricle. Okay, the lower part of the right ventricle is also called as the inflow tract. Okay, inflow tract. The upper part of the right ventricle is also called as the outflow tract, because from here the blood is outflowed into the pulmonary aorta. So the lower part is the inflow tract, the upper part is the outflow tract. Lower part inflow tract is rough, upper part outflow tract is smooth. So who is dividing the lower tract from the upper tract? Actually here we have got a structure. This particular structure over here is called, there is a crest here called as supraventricular crest. Okay, so what is this particular crest which we have over here? This is called as supraventricular crest. So supraventricular crest is the one which is dividing the right ventricle into this part is called as the upper smooth part, and this part is the lower rough part, okay, upper smooth part and the lower rough part, okay. Now we shall discuss this right ventricle in three scenarios. The first thing I have already shown you, that this right ventricle is having an inflow tract, okay. Inflow tract is also called as the rough part of the right ventricle. Second important thing, we have got the outflow tract. We have got the outflow tract which is also called as the smooth part, right, smooth part, and there are some other names that are given, that is called as conus arteriosus. What is that smooth part called? Conus arteriosus or infundibulum. Conus arteriosus or infundibulum. So both of them are separated by, write this thing also down, that both are separated by, what is this? Both are separated by supraventricular crest. Supraventricular crest. Both of them are separated by supraventricular crest. Okay, first we shall discuss about the inflow tract, okay, and even in the left ventricle also, this is right ventricle, even in the left ventricle also there are no much other things to be discussed, okay, there are only few things. So most, even in left ventricle also you have got inflow tract, you have got outflow tract. Inflow tract is rough there, outflow tract is smooth there, okay, but the names change. What are the names? I have already discussed in the development of the heart. Now coming to the inflow tract, what are the important things you need to know regarding this inflow tract? So in the inflow tract you basically have got two important structures. What are those two important structures? One, you call it as a right atrioventricular orifice. What do you mean by right atrioventricular orifice? I told you that here you will have an atrioventricular orifice, isn't it? For example, you see here, this part over here is your right atrium, and this is your right ventricle. So connecting right atrium and right ventricle, here you will have a structure, right? You will have an opening here. This particular opening over here is called as atrioventricular opening or tricuspid valve, remember, right? So this is called as atrioventricular orifice or AV orifice, or you can simply write it as tricuspid valve. This is called as your tricuspid valve. And if you remember that tricuspid valve is having three cusps, I told you, right? But whatever, we'll discuss that right now again. Next, what is the next important part in the inflow tract? You will have a tricuspid valve complex, not tricuspid valve just, it is tricuspid valve complex. So tricuspid valve complex is having few important things. The first important thing is tricuspid annulus. Tricuspid annulus is the first important thing. Next, you have got cusps over here, right? Next, third important and the new thing which you know is chorda tendineae. I think most of you know what are this chorda tendineae, right? You have got chorda tendineae, and fourth important thing you have got is the papillary muscles. So papillary muscles or your pillars. Papillary muscle or also called as your pillars. Now the same things will also be present on the left ventricle side. Yes or no? Now when it comes to the cusps, okay, there are three important cusps here. What are those three important cusps? Last time we discussed anterior cusp, we have discussed a posterior cusp, we have also discussed a septal cusps, right? So these are the three cusps that are present. Now first we shall discuss about tricuspid annulus. So tricuspid annulus, in the sense, this is your tricuspid valve, right? So this tricuspid valve, this ring of tricuspid valve, whatever is there here, is called tricuspid annulus. Okay, it is having how many walls? This is your anterior wall, not valve, it is wall. This is your posterior wall, anterior wall as well as your posterior wall. When it comes to cusps, you have got a cusp over here, this is called anterior cusp. You have got a cusp over here, this is called as a posterior cusp. You have got a cusp over here, this is called as what? Septal cusp. Okay, now what we will do is that we shall cut down the ring like this. You see, we shall cut down the ring like this, and if this is the ring, I have cut down the ring down and I am opening the ring like this. Okay, when I cut down the ring and I open the ring, this is how it looks. Then where are the cusps? Where are the cusps here? See, one cusp over here you call it as, yeah, one cusp over here you call it as, this is the posterior cusp, okay, and let us say this is a septal cusp, and let us say this is the anterior cusp, okay. So what are the cusps over here? This is your posterior cusp, this is your septal cusp, this is your anterior cusp, okay, anterior cusp. Actually this is not the line of incision here, this is not the line of incision, the line of incision which I made is here. So when I made it here, what is this? This is your anterior cusp, this one, right? Here in the middle, what do you have? In the middle you have got septal cusps here, and last you have got the posterior cusp. Okay, I made an incision over here like this. If this is a thing, like this, I made an incision down, so it opened like this. The center one is what? Septal cusp. Okay. Now next important thing is that when you look into these cusps, okay, we have got three important zones over here. For example, you see this particular zone which I'm drawing, which I'm highlighting over here, this is called as the basal zone. Okay, what is this particular zone called as? This is called as the basal zone. Okay, now after this basal zone, the next zone which you have over here, after this basal zone, see here you have got another zone like this. You see, here we have got another zone. What is this particular zone? This particular zone over here is called as clear zone. One is basal zone, and this particular zone over here is called as your clear zone. Okay, so yeah, this particular one over here is called as your clear zone. After this clear zone, down here you have got another zone. Down here you have got another zone over here. See, this particular zone over here is called as a rough zone. This is called as a rough zone. So how many zones do we have? And by the way, what is this? This black color ring over here is called as your annulus. Annulus, right? So just beneath the annulus, we have got this particular zone called as basal zone, right? And you see this zone where nothing is present, right? You see with the red I'm highlighting here, this is called as your clear zone. And these separations over here, this is called as a rough part, is called as a rough zone. Now all of these three zones are joining over here, you see. These three zones are joining over here. So these are joining with the help of what? They are joining with the help of commissures. There are two commissures over here. So this particular commissure is present between the posterior, what do you call this? This is called as a posterior cusp and the septal cusp. Between posterior and septal cusp, this particular commissure, what you can see here, this is called as posteroseptal commissure. Posteroseptal commissure. In the same way, this particular commissure which you have over here between the anterior and septal, this is called as anteroseptal commissure. This is called as anteroseptal commissure, right? And let us say for much more clear identification, let us say this is the wall of your ventricle. Okay, you see this particular part over here, you see this is the wall of your ventricle, Now within this wall of your ventricle over here, you have got some muscles. You see some muscles over here. These muscles are called as papillary muscles. It means wall of the ventricle. Here I have got some muscles over here. These muscles are called as your papillary muscles. Okay, so what are these muscles over here? These are called papillary muscles. Okay, so these walls over here are having muscles. These are called as your papillary muscles, or you can call it as pillars or papillary muscles. Now from these papillary muscles or pillars, you have got structures called as chorda tendineae. Okay, so now all of you just remember here, some of the chorda tendineae, okay, let us start from this color. Some of the chorda tendineae, they go up and all the way attach to the commissure like this. You see, some of the chorda tendineae are going up and attaching to the commissure. Such chorda tendineae are called as commissural chordae. What are they called? Commissural chordae. So I'm writing it as A. So what does A stand for? A here stands for commissural chordae. Commissural chordae. Okay, so A here stands for commissural chordae. Next important thing, the next important color is dark blue over here. So the next important thing is that some of the fibers over here, okay, some of the fibers over here, they go and some of the chordae tendineae go and attach to this layer. What is this? This is the rough. Some of these go and attach to this particular layer. Okay, you see these are the cusps over here. These are the free margins of the cusps. So if this entire thing is a cusp, right, so this blue color line indicates the free margin of the cusps. So they are attaching to the free margin of the cusps. So that is why this is called as free marginal chordae. B is called free marginal chordae. B is called free marginal chordae. Now after this free marginal chordae, next important thing is that some other chordae that go and attach all the way to this region. What is this region called as? Rough zone. Okay, so if they are going and attaching to the rough zone, what do you basically call them as? You call them as a rough. What do you call? You call them as rough zone chordae. You call them as rough zone chordae. So how many types of chordae tendineae we are having? One attaching to the commissures called as commissural chordae, free margin of the cusp, free marginal chordae, rough zone is called as a rough chordae over here. Okay, and after this we have got another group. Okay, now these group are going all the way and they are attached to the clear zone. Where are they attached? They are attached to the clear zone. These are D. D here stands for deep chordae. These structures over here, these chordae over here are called as deep chordae. So these chordae over here are called as your deep chordae. Okay, and finally we even have got chordae that are going all the way up and attaching to your basal zone like this. So these chordae which are attaching to the basal zone are called as basal zone chordae, or simply called as basal chordae. Basal chordae. So how many different types of chordae we have got? We have got 5 different types of chordae attached to the papillary muscles. One is called as commissural chordae, free marginal chordae, rough zone chordae, deep chordae, as well as a basal chordae. So these are the different kinds of chordae which we see attached to these ventricles over here. Now we shall be discussing regarding the arterial supply of the heart. Okay, our topic of discussion would be regarding the arterial supply of the heart. Now regarding this arterial supply of the heart, what are the important things you need to know? So previously when I was the first topic in the thorax which I was discussing regarding the aorta, I told you, if you remember, that the aorta is having 3 important, this part of the aorta is called as a ascending aorta. Ascending aorta is having 3 important sinuses, right? These 3 are called as aortic sinuses. After that, if you little bit go up here, you will have a bulb called as aortic bulb. So till here, whatever I have drawn over here is called as your ascending aorta. So from this part, I told you all the way till the lower border of T4. Okay, so let us say if this is your T4 vertebra over here, this is your T4, till the lower border of T4, till here you have got the arch of aorta. From the lower border of T4, whatever aorta is starting and it is proceeding down is called as your descending aorta, I told you, right? So here our topic is here. Now this part is called as your ascending aorta. This part is called as your ascending aorta. Okay, now in this ascending aorta, what are these 3? 1, 2 and 3. These 3 are called as sinuses. Okay, so if you are looking at these sinuses from this particular view, this is how these sinuses look. Let us say, you see, this is the opening orifice. So here I have got one sinus, here I have got another sinus, here I have got a third sinus. So how many sinuses do I have over here? I have got 1, I have got 2 and I have got 3. Okay, 3 sinuses. Now what I'm telling you is that if you divide, if I draw an imaginary line over here, all of you know that this part is called as an anterior part and this part over here will be called as a posterior part. Okay. Now, what are these sinuses? By the way, 1, 2 and 3. So, one is called as anterior aortic sinus, anterior aortic sinus. Next, 2 is called as posterior aortic sinus, and 3 is also called as posterior aortic sinus. But one is on the right, one is on the left. So here you have to write it as right posterior aortic sinus, left posterior aortic sinus. Now, why did I draw these sinuses over here is that you should know that from the anterior aortic sinus, the artery that is coming over here is your right coronary artery, RCA. From the posterior aortic sinus, the artery that is coming over here is called as left coronary artery. So right coronary artery originates from your anterior aortic sinus, left coronary artery originates from your left posterior aortic sinus, left posterior aortic sinus. So if you look at the heart in this way, right? So here this is a place where your aortic sinuses are present, yes or no? So here what are the aortic sinuses you have got? Just remind me guys. So what are the aortic sinuses you have got? See, here I have got the first aortic sinus, here I have got the second, here I have got the third. Okay, here I have got the third. So from this particular, so let me write down 1, okay, 1, 2 and 3. So here from the first aortic sinus, whatever artery that is coming down over here is called as your right coronary artery. From the third, whatever artery is coming down over here is called as your left coronary artery. So let me write this thing down over here, that this artery is your right coronary artery, this is your left coronary artery. Okay. Now this particular right coronary artery, what is the course of this artery? This particular right coronary artery comes all the way till, what is this? This is the inferior surface of the heart. It comes all the way till the inferior surface of the heart, and it turns posteriorly and goes in this way. Okay. But it gives one branch that supplies to the inferior surface of the heart like this. So this branch which is given by that, which is supplying the inferior surface of the heart, is called as your right marginal artery. This is called as right marginal artery over here. In the same way, what is this? This is your left coronary artery. This left coronary artery is divided into 3 branches. Okay, so what are these 3 branches? See, one branch makes a circle like this and goes on to the posterior side, and what does it do? This is anastomosing with the right coronary artery. This is called as left circumflex artery. So what this artery has to be called as? This artery over here is called as your left circumflex artery. Okay. Now from this particular left circumflex artery over here, you see a branch that is coming down all the way. So this branch that is coming down is equivalent, looking like a right marginal artery. So you call it as a left marginal artery. So this one over here is called as left marginal artery. One we have is the right marginal, another one we have is the left marginal artery. Second artery, okay, the second artery which is given here by the left coronary artery, this second artery passes down all the way. You see, it is passing down all the way along what? Along the anterior interventricular groove. Okay, along the anterior interventricular groove, and it turns back posteriorly like this, and it goes all the way here. Okay. Now from your right marginal artery also, a branch is coming all the way and attached to this particular artery. Now this artery over here, okay, what is the name of this particular artery over here? This particular artery over here, which is a branch of right coronary artery, is called as posterior interventricular artery, because it is present in between 2 ventricles, interventricular artery, posterior interventricular artery. And this artery in the front is called as left anterior, okay, let me change the name. The artery which is present in the front is called as anterior interventricular artery. When there is posterior interventricular, there will be anterior interventricular artery, or you can call it as left anterior descending artery, LAD, or left anterior descending artery. So these are the arteries which you have in the heart, right? These are the arteries. This is the arterial supply of the heart over here. Now, another important thing I want to mention over here is that you know that we have got some specialized connective tissue. For example, this particular node over here is called as SA node. You know it. Okay. Below the SA node, you have got what? This is called as your AV node. Okay. Attached to the AV node, you have got a structure called, what is this structure called as? Bundle of His. This is called as your bundle of His or His bundle. Okay, now this bundle of His divides into right bundle branch, left bundle branch. Okay, this is called as your right bundle branch, left bundle branch. Now the right and left bundle branch, they hang down all the way like this and give the fibers over here. These fibers which are given over here are called as your Purkinje fibers, right? What are these? These are called as Purkinje fibers. So this is your entire conducting system of your heart. Now out of all these, your SA node, your AV node, right? SA node, AV node and bundle of His, all these three are supplied by right coronary artery. Okay, and after that your right bundle branch, your left bundle branch and the later part is completely supplied by a left coronary artery. And its continuation, the Purkinje is supplied by the left coronary artery. Okay, so these are the important things. Next important thing, a clinical part which I want to tell you over here is that all of you just pay attention here. This entire wall, right? This entire wall is called as the inferior wall. This inferior wall is mainly supplied by which artery? Right coronary artery. If right coronary artery is occluded, then patient will have what kind of myocardial infarction? Inferior wall myocardial infarction. Next, whatever you can see, this entire surface is called as the anterior surface of your heart. Anterior surface, what is the only artery? See, this is a dotted artery which means on the back. These two are dotted arteries which means on the back. This is also a dotted artery which is on the back. The only artery which is drawn without a dotted fashion in a linear way here, which is passing exactly in front anterior to the ventricles here, is your anterior, what is this? Left anterior descending artery, which is supplying this wall. What is this wall which you can see? This is called anterior wall. If this artery is occluded, then patient will have what kind of MI? Anterior wall MI. Next, this particular wall over here is called as a lateral wall. Okay, lateral wall, what is the artery that is supplied over here mainly? That is your left circumflex artery. If your left circumflex artery is occluded, then what will happen? This entire lateral wall is infarcted. So you call it as lateral wall MI. In the same way, posteriorly, what is the main artery? That is your posterior interventricular artery. If that is occluded, that will lead to posterior wall MI. So how many types of myocardial infarction do you have? You have got basically 4 different types. One is called as inferior wall MI. There are many other types, but as you guys are all first year, second year students, this is more than enough for you. So next one is called as anterior wall MI. So even while reading the ECGs also, you have to look at the ECG, how inferior wall MI looks, how anterior wall MI looks and all. Next you have got inferior wall MI is the most common basically. Next you have got the lateral wall MI. Next you have got is a posterior wall MI. Okay, now when it comes to the inferior wall MI, what was the artery I told you? Right coronary artery. When I tell anterior wall MI, it is your left anterior descending artery. When I tell the lateral wall MI, it is your left circumflex artery. Posterior wall MI, it is a posterior interventricular artery. Okay, these are the important branches which you need to know. Now we shall be discussing regarding the veins of the heart. Veins of the heart or the venous drainage of the heart. Okay, so we'll discuss in 2 pictures, anterior and posterior view. Now anteriorly you have to know that the inferior part and all, from the apex you see a vein that is going to the right and it is going on to the back. Okay, this is the vein that is going on to the back. In the same way, from the lateral side also you see, from the anterior side, from the anterior wall and from the apex, you see the vein going on to the lateral side and from there it is going on to the back. Okay, so this vein from the anterior side, which is going on to the posterior side, on to the inferior wall side, this one over here is called as lesser cardiac vein. What is this? Lesser cardiac vein. And this vein over here is called as greater cardiac vein. So lesser cardiac vein and greater cardiac vein. Where are these lesser and greater cardiac veins going? On the posterior side, we have got a sinus. You remember I told you posteriorly we have got a sinus. You remember that anteriorly I told you, if this is the heart, I told you this particular structure in between is called as atrioventricular groove or sulci. In this I told you this is the right half. This is the left half where greater cardiac vein is there, the right half where the lesser cardiac vein is there. Posteriorly also you have got atrioventricular groove, that is called coronary sinus, right? So this sinus which I have drawn right now is coronary sinus. So the lesser cardiac vein is draining into coronary sinus, the greater cardiac vein is also draining into coronary sinus. What did I tell you? Around 65% of the entire heart circulation, the venous blood drains into your coronary sinus. Now if I turn it back, so you should be able to understand that here there is coronary sinus, for example, okay, just coronary sinus. You remember I told you there is one vein that is coming from the front to the back and draining here, from the front to the back and draining over here, right? So now these are called lesser and greater cardiac vein, yes or no? So this vein over here, you call it as which vein? What is this vein over here? This is called as lesser cardiac vein or small cardiac vein or lesser cardiac vein. Okay, in the same way onto the opposite side also, you remember that I've drawn a vein that is coming all the way like this and draining here. You see, this is called as what? This is called as greater cardiac vein. One is lesser cardiac vein, another one is your greater cardiac vein, lesser and greater cardiac vein. Next important thing is you have got a vein on the top posteriorly, and down here you have got three separate veins. So the vein which is on the top, is completely oblique like this, you see, completely oblique. So that is why you call this particular vein as oblique vein of left atrium, oblique vein of left atrium, or you can call it as vein of Marshall, oblique vein of left atrium or vein of Marshall. Next here you have got three important veins, right? You see there is one vein that is going and draining the blood into your coronary sinus. You see the second vein over here. In the same way you see the third vein over here. So what are these three veins? This particular vein over here is called as marginal vein. This is called as marginal vein. This particular vein over here is called as posterior vein of left ventricle, and this particular vein over here is called as middle cardiac vein, So marginal vein, posterior vein of left ventricle and middle cardiac vein. So all these three veins are draining into your coronary sinus. So overall, even if you want to remember this with the pictures, your wish, but overall the question will be asked from this, that what are the veins that drain into coronary sinus? Now you tell me what are the veins that drain into coronary sinus. One is your greater cardiac vein, Second one is your small cardiac vein or lesser cardiac vein, or your lesser cardiac vein. Next one is your marginal vein. Just remember one vein called as marginal vein. Next, after that, the fourth important one is your posterior vein of left ventricle, Next, we have got your middle cardiac vein, right? You have got your middle cardiac vein, and finally one vein that is oblique vein. Sixth one is your oblique vein of your left atrium, So these are the six important veins that are draining directly into your coronary sinus. So now we shall be discussing regarding the mediastinum. So what are the borders of mediastinum? What are the contents of mediastinum? We shall be discussing now. So in this particular picture, you can see that this particular part over here anteriorly, this is called as your sternum. Okay, and these are the vertebrae on the back. Now in this vertebra, this particular vertebra is called as a T4 vertebra, and down here you have got the T12 vertebra. So for example, and this one is called as your T1 vertebra. So if you are drawing a line perpendicular, so if you are drawing a line touching the sternum to this T1 over here, and second line along the inferior border of T4, right? So this space, whatever you can see over here, the space is formed, and this space, whatever you can see over here, is called as superior mediastinum. This is called as what? Superior mediastinum. Down to the superior mediastinum, this entire part over here is called as inferior mediastinum. One we have got is the superior mediastinum, next we have got is the inferior mediastinum. Now this inferior mediastinum is divided into three parts: anterior part, middle part and posterior part. Okay, so anterior part, middle part and posterior part. So this means this is called as the anterior mediastinum, this is called middle mediastinum, this is called posterior mediastinum. So we shall first draw this mediastinum, and then we shall draw the structures that are located in all of these mediastinums over here. Okay, so we shall see, but one thing I'm telling you, middle mediastinum is the place where your heart is located. Okay, your heart is located in the middle mediastinum. First of all, let us write down the borders of superior mediastinum. So if you look at the borders of superior mediastinum, anteriorly what do you have basically? So anteriorly, so now we shall discuss what are the contents that are located in superior mediastinum, and we shall discuss what are the contents that are located in anterior, middle and posterior mediastinum. Okay, so first of all, let me draw down the mediastinum picture over here. I'm just drawing a gross picture. Okay, so first important thing let me draw is the sternum. Okay, so let us say this part over here is your sternum. You see, this is the sternum. Down here you have got your xiphoid process over here, and by the way, not to forget that here you have got your diaphragm like this. Okay, resting on the diaphragm you have got your heart, right? So exactly at this particular position over here you have got your heart. I mean mainly the right and left ventricle, right? The right and left ventricle are resting on the heart because that is a diaphragmatic surface I told you. Next important thing is that coming out of this heart you have got this particular structure called as your aorta. So this is your arch of aorta over here, arch of aorta, and going down all the way is your descending aorta over here. So if I make this picture a little bit bigger over here, so this will suit the picture which we are drawing here. And posteriorly, what did I tell you? Posteriorly you have got your vertebra, right? So let us say that this is your C7 and here you have got your T1. Okay, T1, and all the way down here I'm drawing the vertebra. This is your T2, and you have got your T3, T4, so on so forth, right? So on so forth, and finally you will end up having T12 over here. So let us say that is T12, and let us say that this is T1. Okay, now what I'm doing is that I'm drawing a line from the tip of the sternum all the way till T1 over here. The same picture, see here, I'm drawing all the way here. Just beneath this, whatever structure you have got, see this entire thing is called as your superior mediastinum. Okay, and next important thing, I'm drawing along T4 as well. So let us say I'm drawing a line all the way along, let us say this is T4, okay, lower border of T4. So this entire mediastinum over here is called as your superior mediastinum. The next important thing which you can see over here is that here you have got a structure, right? All of you know that exactly behind the sternum you have got a structure like this. What is this? This is called as your thymus. What is this? This is called as your thymus. This is called as your thymus, and all of you know that this is your arch of aorta. No need to mention, but I'm just mentioning it now. And this part over here is called as your descending aorta. I mean your thoracic aorta. You know it, right? This is called as your thoracic aorta. Next important thing. What is the next important thing here is that posteriorly here you have got a structure. You see, you have got a structure over here posteriorly, and what is this? This is your foot pipe. What is this foot pipe called as? Yes, this is your esophagus. Okay, so posteriorly you have got this structure called as esophagus. Next, anterior to esophagus, you have got what? Trachea. Let us say this is your trachea. And you know that the trachea is bifurcating into bronchi. So one end is bifurcating into right bronchus, and now I am drawing the bronchus, that is your left bronchus. You see, this particular bronchus over here is your left bronchus. So let me overlap this. Actually, this is not overlap, just for you to understand, I'm just drawing it like this. This is your left main bronchus. Okay, what is this? This is your left main bronchus. Yeah, this is your left main bronchus over here. Next important thing is here down you have got a vena cava. This vena cava over here is called as your inferior vena cava. I hope you know this. Okay. Next, in the same way, up here you have got an artery. What is this artery that is called? This is called as your right pulmonary artery. What is this? Right pulmonary. Let me write down all the things. So this is called as your esophagus. Anyways, we might not be able to draw down all the structures over here. This is your trachea. This is your trachea. And this one over here is your right pulmonary artery. Right pulmonary artery. Okay. Right pulmonary artery. Right. Now, what are the important structures which you have over here? Before that, now you tell me, what is this artery over here? Yes, this artery is called as your brachiocephalic trunk. Okay, brachiocephalic trunk, and after that here you have got your common carotid artery. You remember that? Brachiocephalic trunk, you have got your common carotid artery, right? What common carotid artery? This is the left common carotid artery. Next, and another important thing is here you have got another artery that is called as the left subclavian artery. Clear? And you know that this brachiocephalic trunk, this you are looking from the side, right? But brachiocephalic trunk in normal picture, brachiocephalic trunk will divide into right subclavian and right common carotid artery. Okay, so here we have got left common carotid artery, here we have got left subclavian artery. So these are the things here. So what is this? This is your brachiocephalic trunk. This is your left common carotid artery. This is your left subclavian artery. Okay, left subclavian artery. Now let us write down all the structures over here. First, let us discuss about superior mediastinum. Superior mediastinum. Now in superior mediastinum, what structures do you have? First, what are the organs do you have here in superior mediastinum? First, just look here. Let me first completely highlight this thing so that it would be easy for you to name these structures. So all these structures which are located over here are your superior mediastinum. Okay, all these structures here are superior mediastinum. Now you tell me, what do we have? Do we have thymus in the superior mediastinum? Yes. Do we have esophagus? Yes. Do we have trachea? Yes. These are the three organs that are located in the superior mediastinum. What are the things? One we have got is the thymus. Back side we have got, posterior we have got the esophagus, and in between we have got the trachea. These are the three organs that are located in the superior mediastinum. Now after these organs, let us discuss what are the arteries that are located in the superior mediastinum. Arteries that are located in the superior mediastinum. First important artery. You see this arch of aorta is also slightly touching the superior mediastinum. So arch of aorta, brachiocephalic trunk. Next we have got left common carotid artery. Next we have got left subclavian artery. These are the four structures that are present. What are the four structures here? Arch of aorta, little part of arch of aorta, not the complete part. Next we have got the brachiocephalic trunk. Next we have got the left common carotid artery. We have got the left subclavian artery. Okay, these are the arteries that are located over here. Now let us discuss about the veins and the ducts. Let us discuss about the veins and ducts that are located here. Now veins here, obviously you cannot see the veins. You cannot see the veins here, but just assume that what are the veins you have got in the superior mediastinum in the neck region? Superior vena cava will be there or inferior vena cava? Inferior vena cava is down here. So exactly opposite on the top here, what vena cava you will have? Superior vena cava. Okay, superior vena cava. How superior vena cava is formed? With the help of brachiocephalic vein. Along with that, the duct which you have is thoracic duct. So I don't think so. This is much difficult to remember if you look at the picture over here. Now, coming to another important mediastinum. What is that? We have got anterior mediastinum. We have got a middle mediastinum. We have got the posterior mediastinum. So down here you divide the mediastinum into three parts, right? So anterior, middle and posterior. So let us see what are the structures. So first, anterior mediastinum. Let me highlight this structure. You see this structure which I am highlighting with the yellow over here, this is your anterior mediastinum. Now in anterior mediastinum only one thing you can see. What is that? Thymus. Very good. So in anterior mediastinum you can see only one important thing, that is your thymus. In middle mediastinum what you can see? In middle mediastinum you can actually see the heart. Surrounding the heart, what do you have? You have got the pericardium. In the middle mediastinum you have got the heart as well as your pericardium. So let me even draw this middle mediastinum. So till here you have got your middle mediastinum. So this is your middle mediastinum. What are the organs that are located in the middle mediastinum? Only you have got the heart and the pericardium. Okay. So you have got the heart, you have got the pericardium surrounding it. Pericardium surrounding it. Now posterior mediastinum, what do you have? Again, posterior mediastinum, I think you have got only one organ here. What is that? Esophagus. Posterior mediastinum, I have just got what? Esophagus. Esophagus. Done. Coming to the arteries, here anterior mediastinum you will have small vessels. I mean there is no particular name of these vessels. So just remember it as small vessels are located over here. Okay. So not much prominent vessels here. So coming to the middle mediastinum, prominent vessels in the sense like artery, that like ascending aorta, descending aorta, thoracic aorta, not that. Only small arteries, small veins are located in the anterior. Okay. So coming to the, we are discussing about the major. Middle mediastinum, what do you have? You have got ascending aorta. Okay, you have got ascending aorta, and what is this? This is called as your pulmonary trunk. Okay, ascending aorta and pulmonary artery. You have got ascending aorta and you have got pulmonary trunk dividing into right and left pulmonary artery. Right and left pulmonary artery. Next, coming to the posterior mediastinum, what is the artery which you have over here? What is this? This is your thoracic aorta. What is this? This is your thoracic aorta. Thoracic aorta. Thoracic aorta is the one which you have. Coming to the veins. Coming to the veins, again here the veins are not that prominent, but remember the veins in the middle mediastinum as SAP. Remember the veins in the posterior mediastinum as HAT, hat. So what is SAP? S stands for superior vena cava. Superior vena cava. A stands for azygous vein. Azygous vein. And P stands for pulmonary veins. Pulmonary veins. In the same way here, H stands for, if A is azygous, H will be hemiazygous. Hemiazygous. And again remember, A again is for azygous, A again is for azygous vein, right? And T is for thoracic duct. Thoracic duct. Okay, thoracic duct. So these are located in the posterior mediastinum. So these are the structures that are located in the anterior, middle as well as the posterior mediastinum. These are the contents over here. Okay. So this is all the important things which you need to know, the topics regarding the thorax, guys. So these are all the important topics, right? Most of the MCQs will be framed from these topics over here. So thank you so much for watching my video. Goodbye.